Good evening, everyone. I will call the July 1st Select Board meeting to order. I think we have one item that we're going to move to next week, and that's the follow-up from town meeting and the election with the length of our agenda tonight. And I don't think that there are any other changes, so we'll accept the agenda. Before we begin, I'm going to confirm that everyone who is present can hear me. I'll go through the board members first in the order in which I see you. Melissa Murphy.
Here.
Jason Bridges. Christy Ferrantella.
Here.
I'm actually not seeing Matt on yet, but we'll hope that he gets on in a few minutes. And then I'll go through staff members who are present. Libby Gibson.
Present.
Amy Baxter.
Here.
Artel Crowley. Ken Beaugrand.
Here.
Janet Schulte.
Here.
Erica Murney.
Present.
William Pittman.
Present.
Tucker Holland.
Present.
Rachel Day.
Yes, I'm here.
And we do have board member Matt Fee on now. Matt, can you hear me?
Yes, I can.
And then we have a few other people present. We have Frank Daly. Frank, can you hear me?
Yes, I can. Can you hear me?
Yep. Jeremy Cohen. Jeremy, can you hear me?
I'm here. Thank you.
David Quinn. David, can you hear me? Okay, I'll go to Liz McIsaac.
I'm here.
Okay, you can just mute. Malcolm McNabb.
Yes, here.
Thank you. Okay. This open meeting of the Select Board is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, we have been advised and directed by the Commonwealth to suspend public gatherings, and as such, the Governor's order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. The order, which you can find posted with agenda materials for this meeting, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. This Select Board meeting will feature public comment through the Zoom webinar where you can log on and be an attendee. You can log in by phone, or you can participate with the Q&A. As I said before, all of our meeting materials are on the town website. As we turn to the first item of our agenda, the chair will introduce the agenda item and the speaker. After they conclude their remarks, the chair will recognize members if they raise their hand, or any other members of the public on the appropriate items. Please hold until your name is called. Please mute your phone or computer when you are not speaking. Please remember to speak clearly so that we can generate accurate minutes. Each vote will be taken by roll call vote, and please remember to not share your screen as it can be captured by the recording. Now we will turn to our first item on the agenda. We just have two announcements. I'll turn it over to the town manager.
Thank you. This meeting is being video and audio recorded. That's the first announcement. Secondly, the census. We have an update from our census coordinator. I'm just going to read some of it. In 6 weeks, census takers are scheduled to go door to door to follow up with Nantucket households that have not responded by then, online, by phone, or by mail. Our current rate of response is 25.4%, with rates at a little over 40% in the Mid-Island areas. Nationally and statewide, the response rate is over 60%, so we are very low. We stand to lose a lot of money over the next 10 years with an undercount. As an example, for every person counted, about $2,400 per year for the next 10 years will come to Nantucket to do things like pay teachers, fund health clinics, feed families in need, fill potholes, protect our watershed, and more. A family of 4 represents almost $100,000 towards these programs and services. It's safe, easy, and quick to take the census at 2020census.gov. So please go there and sign up and count everyone in your household now. Also, there is a video that Remain has produced, and it will be posted on the town website. So the message is, please sign up.
I just got another message from Dr. Pearl. She just hasn't received an invite yet.
Oh,
Dawn, the email that you sent me is not the email that we sent it to.
Okay, that's the email she gave me.
Okay, so that's a new one for us. So I'll have it sent to there.
Perfect. Thank you, Erica.
On the census, Dawn, it's Matt.
Yes.
Just, I had a call today from someone asking for one of my people living in one of my cottages to apply for residency. That I guess he was a resident maybe somewhere else in Massachusetts. So do you have to be a resident to be counted in the census? My understanding was you could be a long season and you still counted if you're here that day.
I thought you had to be in residence in April, or is that not correct anymore? It's fine if you're in residence now.
yeah, it is. You can be a seasonal resident.
And as long as you were here April 1st, or can you be here now?
You can be here now.
Then our count should be way higher. And I don't know why people aren't, if that's the case, I don't know why they're calling and not counting this kid, because he's here year round. And he's here with his wife. I don't know why he's not counted. I'll follow up and call them, but I think people, just as a public information, if you can count anyone here now, we should have 25,000 people.
Well, but you got to go and sign up.
Okay, anything else on the census? Just everyone get counted. COVID-19 weekly update. Is there anything that any select board members or the public wish to comment on? Okay, seeing no hands. Roberto is off tonight. I think that may be Malcolm and our teller here in his place to give a report.
Yes, Madam Chair. So I asked Malcolm if he would, Dr. McNabb, if he would please give an update about the sewer testing as well as the metrics and whatever else he thinks would be pertinent. And Mr. Crowley's going to review inspections and how those are going at present.
Excellent. I'll turn it over to you, Dr. McNabb, but you're muted. You're speaking, there you go.
Now I'm speaking to you all now. Good evening. So I was sort of asked to do an update on the metrics and the sewer report, which is quite interesting. There's been some controversy because the first sampling had an estimation of 160 cases, and the second one done at a different time had 0 cases. And I can talk about that in a minute. But the mere fact that we had 160 cases at that particular sampling time, just to me shows the fact that, a lot of people have the virus, a lot of people don't have symptoms, and they do spread it, however. And I think I'm not surprised that we certainly have a lot more cases than we do by the official testing. Now that 160 number, again, it could be higher, it could be lower. It is done by a very complicated model, which I tried to dig into the details of it, and it was not readily accessible. But we have to accept whatever the number is, either it's higher than 160 or lower than 160, that we have more cases than in fact we actually have reported officially. Why we had the difference in the two tests? The first was taken on a Sunday, Monday, and the second one was taken on a Monday, Tuesday. It may be we're capturing people coming to the island, staying for that period of time, and then leaving. That's a theory, I don't know. Also, remember the test is only one test, and it is just an estimation. But it's very useful to us in the Board of Health because it does reinforce the issue that we, in fact, have a significant number of cases on the island. If we take the 160 as a valid number, that would still indicate a relatively low percentage on the island. I don't know what you want to use as a denominator, but say we had 15,000, that's about 1%. If we go to 30,000, that's 0.5%. So it's a relatively low number. If we look at our metrics, we've been following 6 metrics, and if any of these goes out of the range, then we would seriously talk about putting in more restrictions and rolling back some of the activities that we've opened up in the last few weeks. The first one is positive test rate. The metric says we should keep that under 10%. It's now at about 1.5%. Number of individuals who have died, that is only less than 1% on the island, thank goodness. Number of cases in the hospital, we like to keep below 10. Healthcare system readiness is a quantitative response of yes. Testing capability is also a quantitative response, and we certainly have that capacity, and contact tracing capabilities. We have that at the present time, and if it got out of beyond demand, that would be one of the indicators that we would roll things back. So at the present time, based on the metrics, based on an estimation of the total number of cases on the island, we still have to be vigilant, and I suspect we're going to see more cases. I'm pleased to walk down Main Street today, and I saw a lot more people with masks than I had before. But we're not a whale ship anymore where we're in quarantine for 4 or 5 years. It's a different time, and people come and people go, and that's my concern. If we're going to shut down the island, we'd be done. We wouldn't have the cases, but we can't do that right now. We just have to keep watch, wear our masks, social distance, and we'll follow it very closely. And if things start to get out of our matrix or the numbers start increasing, then we'll have to seriously consider about taking other steps. Questions? Matt?
Yeah, Malcolm, when you dig into the sewer stuff, does II, was one of the days raining and one of them not? And does II and extra water flowing in, could that dilute it or not?
Yeah, I think you'd have to ask Gare. I think when I talked to him, one of those days was a low flow day. I'm not a sewer expert. I just look at these numbers. I don't want to get too quantitative about them. They're qualitative to me, that we have more cases than we can that are tested, and that's not an unusual factor. We just have to watch the numbers very carefully.
Christy, and then we have a question from the public.
Back in May or April, we tested the island home residents and their staff. Is that something that we're planning to continue to do, especially as we're seeing more cases on island?
They should be retested. If you look at the death rate across the country, almost 40% of deaths occur in facilities, nursing homes, extended care facilities. That's where the real risk, besides the usual known risks for the disease, but we need to retest those people.
Rachel, did you have a comment on that?
Yes, I just wanted to state that there actually was guidance that was issued. I got it in paper form today that actually requires a baseline testing of all nursing home staff in Massachusetts right now to be done. And I might have the date wrong. I don't have it right in front of me. I think it's July 19th. I could get it in a second.
That is correct, Rachel.
Thank you. So what they're doing is they're working with Diane Pearl right now and the hospital to do that. So they are hoping to get that done by this weekend so that all the staff are retested. And then they provided specific guidelines. So if there are any positive tests, the staff, when you have to retest them, as well as negative tests. And I believe at minimum, it's every 2 weeks going forward until further issue. So that is happening or will happen.
Thank you.
Mary Longacre has her hand up. Could we let her in to ask a question? Mary, can you hear me?
Yes, thank you. For Dr. McNabb, the June 5th sewer test was the last one that we heard that we'd received. Have we received any more recent results? And
Yes, one from, I think it was the 22nd, which actually showed 0, no trace of the virus. But again, that was a Monday, Sunday. It's supposed to be Sunday, Monday. There may be difference in days of travel. I don't know. And again, it's a one-time test. You'd really have to almost do it every day to get a true picture.
Understood. Thank you.
It's a tool. It's a tool.
I was glad to see that it wasn't double. Better that it was not any.
Yeah, but I think I really think the island's doing a great job. But you know, I'm starting to see more and more people, and I know close friends who have all kinds of family members coming and going, and people coming and going. We have to be really careful. Now we're getting into that point where we really have to watch carefully.
Jason?
Thank you, Madam Chair. I just wanted to, just a kind of point of reference. I'm reading the report from the 22nd, the most recent one. And it says your sample had no detectable levels of SARS-CoV. 48% of all samples collected since May also had no detectable levels. So it's not the first time this has happened. Because when I first saw it, Malcolm, I thought, oh, this must be like something went wrong. But if half of the samples have been similar, then maybe it's valid to some point.
It's a tool. It's going to vary day to day. And remember, there's a threshold of concentration where you can't actually detect the virus. And I don't know what, I tried today to go onto their website and really dig into the methodology and the testing and so forth that they do. And it was kind of really hard. I think we have to look at it as a tool.
Any other questions? Do we want to hear on the hospital? While we're talking about testing, I had asked Dr. Pearl earlier if she could elaborate a little bit more on the process for the people who want to go in and pay for tests, either for themselves or for their employees, because there's been a bit of confusion on how to actually do that, among other things.
Okay. Thank you, Dawn. I'm happy to be here. So I will just give a little summary to start with. We've just reached our 1600th test. So we've tested 1,600 people through the hospital since the beginning. And as you all probably are aware, the explosion in the numbers of people being tested is gratifying and somewhat reassuring that people are interested in being tested. Certainly, the more people we test, the better. The more we will know exactly who has the disease on the island and how to control the spread. As of today, we've had our 21st positive test result. And certainly the number of positives has increased in the last week or two. We were at 13 or 14 for quite a long period of time. And then in the past week or two have had another 7. So the rate of increase is increasing. We I'm also still very pleased that each one of these cases is imported, so to speak, related to travel, and that we haven't found that a case is being spread horizontally from one person on Nantucket to another person on Nantucket who have not gone anywhere. And in that case, that would be community spread of disease. So you might have picked it up at the Stop and Shop, or going out for a sandwich, or whatever, or stop talking to people in a group, or going to a party. So thankfully, we're not seeing community spread, because that's the way it gets going very fast in a community. If each one of these people or family groups brings it with them unknowingly and doesn't spread it to anybody else, that's great. They aren't super spreaders. They aren't likely to cause an enormous start of this disease in our community. So we're keeping a very close watch, as Dr. McNabb said, keeping a watch on all of these parameters and all of this information, so that if we see a spike that doesn't bode well for being able to control it on the island, we'll have to take measures, as the Board of Health is suggesting, to stop it quickly. And so I think all of these are complementary measures that we're taking. We have the portico testing sites in front of the hospital. Sometimes there are traffic jams. We're getting a lot of traffic. And so far, the team that we have created, the teams are doing extremely well and fantastic jobs. Yesterday, I think we had 76 people come through, and that's a lot for a small team of people. But we're doing perhaps, as I said, 50 or 60 a day. This combines people who come through because they don't feel well. They have a sore throat, a fever, a cough, aches and pains, some sort of a symptom. They come through, we obtain the swab for COVID-19 most of the time, and also in some cases, a Lyme titer, a strep throat test, Babesia test, depends upon the symptoms, but they're patients, they're ill. The other portico number 2, as they are labeled, portico number 1 is for patients who have symptoms. The outside portico number 2 is for people who are well, but want to be tested, or are required or asked to be tested by their employer. So this might be emergency personnel, it might be restaurant employees or club employees, and they're coming through, which is a group not covered by insurance, but is being paid for by the employer or by the town, which has a vested interest in some of our testing, and or by individuals who want to be tested. So that's, and the way that people are scheduled for that is by the town website. So you go onto the town website. Apparently, I haven't done it myself, but from what I'm told, it directs a person to the testing, the COVID testing page, and there's a way to contact and get on the schedule for testing. So as Dr. McNabb said, we are keeping a close watch on our community. We're keeping a close watch as we can on who is coming through and how they are, and what are their symptoms, and how many people are testing, and how do they relate to other people who had the disease. Another thing that's quite gratifying is thus far, the people who have been coming through and testing positive are not very ill. They have mild symptoms. And from our standpoint, if we saw an influx of very sick people, now that's when we are going to get concerned, because of our own capacity at the hospital being so limited. So we are going back to our surge plan, dusting it off a little bit, because we made it several months ago, and it's time to reenact the surge plan and get it really up to date again, and be prepared, because that's what we have to do. It's July 1st. I'm happy to answer any questions anybody might have.
Melissa Murphy.
Thank you, Madam Chair. This question may be for Artel or Dr. McNabb, but how is the contact tracing going with the new cases? And then my other question is, the directive, and perhaps this is for you, Dr. Pearl, the directive for those who test positive who are visitors, are they asked to leave the island? Are they asked to stay put? What are we telling folks? Thanks.
So the infection control nurse, who is employed by the Cottage Hospital, but also by the town of Nantucket, has been able to, thus far, with the numbers that she's dealing with, be able to contact every patient who tests positive. And she is the first contact to that patient, explains that they have this positive test and the requirements for self-isolation from others, which is 10 full days of isolation, and what does that mean? And there are many, many questions that every patient has. They are not required to leave Nantucket. They're required to stay away from other people, to isolate and not go out to the store. And if they're living with a family, to isolate from family members if at all possible. When people come through our test sites, we give them a 2 or 3 page document which contains all of the instructions for testing positive and for testing negative from the CDC and the DPH. So people should be very well educated on how to prevent spread. Also, she then gets the contact tracing for who they have been in touch with for the 48 hours before they presented with the test for the test. And there are a lot of detailed questions. How much time were you with certain people? And then she uses that information to contact the people who may have been exposed and ask them also to quarantine themselves and then also to come through and be tested.
Thank you.
Mm-hmm.
Are there any other questions? Any public questions? Erica?
Just a random question. If you are contacted through the contact tracing module, and you're not feeling ill, are you then required to pay for the test, or is that part of the you don't pay?
If you're contacted by the nurse, she will not identify your contact source, but she will say that somebody you know or you have been exposed to a known positive patient, and that we recommend that you come through and be tested. It is actually one of the criteria for testing, which is covered by insurance.
Thank you.
Yep.
Should we get an update from Artel Crowley? Is that next? Artel, you're still muted.
You hear me now?
Yes.
Okay, good. So it has been a challenging spring for the health department. Normally, annual licensing inspections would have concluded by the end of May. Routine inspections for food pools and lodging houses and rec camps would have began on June 1. Due to the pandemic, many facilities delayed their opening well into June. So we were actually out today doing annual inspections, which, I've been doing this 26 years, and this is the first time we've ever pushed this far into the season doing annual licensing inspections. Much of our time over the last 3 months was spent with restaurants, rec camps, food trucks, lodging pools, all COVID related, as well as the public. Working with these groups, absorbed an awful lot of our time, as it should have. And we communicated with these groups primarily through email, Zoom, and by phone. Sent several packets, informational packets for cleaning and sanitizing, staff requirements, social distancing and masks, signage. Takeout food was a big one in the beginning as well. John and Kathy from our office worked with Amy Baxter quite a bit through all these issues as well. We've been inundated with complaints and following up on those complaints from the beginning right through to now. Court started back in the end of May. We've got several correction orders that are in court that we're going through, so that's tied us up a little bit too. We've been stretched, but we seem to be getting the most of it. We were out doing masks today. John Hedden and Megan from our office will continue to do that through the weekend as well. And routine inspections should start on Monday, although we still are doing annual inspections next week as well. So it's been busy. That's sort of just an overview of what we've been dealing with. If you have any questions, I'm more than happy to answer them.
Anybody have any questions? Matt, then Christy?
Yeah, Artel, one of the things that I'm reading about, the governor in Texas is talking about if he could change his mind, he'd go back and be tighter on restaurants and bars, et cetera. I think one of our largest risks is sort of that, 10 o'clock till 2 in the morning. Are we going to be doing any inspections at that time?
I think we should, and staff willing. I mean, there's only so many of us, but we can and we will, as long as there's overtime and whatnot.
No, I'll follow up. Yeah, that's great, because what I've heard from some of the restaurants, they're working really hard, and they're like, they don't want to be shut down. They don't want to go into so they're sort of that we're doing it right. We don't want to be shut down because some people aren't doing it right. In Miami today, what they've done is they're going to have a warning and then $1,000 fine and then a 10-day shutdown because of the issues that they're facing. There was a guy, Roddy McKelvey, sent us all some information. He's probably shared it with the Board of Health, how, where a lot of the restaurants in the opening tracks with the increase. So I think we have to open and do it right, but we have to do it right. And I think if we don't, we will, we could really have an issue. So that's why, I think how we do it and how we enforce it and who does that is really, really crucial to us getting through the summer, getting into the fall without closing. And I'm glad to hear that we're considering it.
It's in everybody's best interest to stay open. It's in our best interest to follow the guidance.
Thank you, Christy.
I had a very similar question, which was, as we've been going through and doing check-ins, are most restaurants and businesses complying, and how often are we doing those checks? I agree with Matt that the most important time frame would be that 10 p.m. to 2 a.m. type situation.
I would tell you that we've been inundated with so much of getting everybody open that we haven't been able to get to our routines, and that will start on Monday. And at that point in time, we'll be able to get into these restaurants, not only do the food safety inspection, also we'll be doing, pools and lodging and all of that. So we'll be able to get in and work on COVID compliance as well and assess that.
Any other questions? Did we have anything more on the emergency orders?
Madam Chair, I don't know if Dr. McNabb or Mr. Crowley want to speak about emergency order number 12, which is the local mask order for Historic District Downtown and Ensconset, adopted by the Board of Health on Monday. Between town admin and the health department and some other people that are pitching in, we're working very hard to get out a lot of information, including, in no particular order, mask zone signage, which will be going up throughout the downtown and Ensconset. We've issued and are in the process of issuing safety protocol signs for every business. That was a request that we had, that the signage be consistent by business. So with the chamber's help, we are getting those out, and we're having several of those blown up very large to post at the boats as you're coming into town, and also at the Rotary. We are working, the COVID educators started on today, actually, I think it was, or yesterday maybe. We have this good idea that came up at the board meeting last week about volunteers, and could we have volunteers around town staffing tables perhaps at various locations. So we are working on that. That's turned out to be quite a bit more of a program than it sounds. So we are hopefully tasking our Human Services Director, Taylor Hilst, with getting this volunteer sort of troop together and getting out the tables and the materials that will go on the tables and setting them up. And anyway, that is an effort that's hopefully about to get underway. We're talking about ordering some T-shirts, wear your mask, and having the educators kind of go around town and hand those out. We have radio spots, lots of social media outreach. There's a video underway. And Roberto has been working on something of an enforcement plan. The main focus here is education. And enforcement is something that would come at the end after repeated non-compliance. And what Roberto is advising, and I'm not sure if this got discussed at Board of Health earlier, but the town and the businesses really need to partner in this. We're getting a lot of educational material out, but businesses really need a no mask, no service policy. And we don't want to have to find businesses or people, but that's what's going to happen if people are, persistent in not adhering to the safety protocols. So again, education in a variety of ways, multiple ways, is well underway, and it's out there. We're hearing some positive feedback. Janet's going to talk in a little bit about the Economic Recovery Task Force, which reconvened on Monday. We don't, again, enforcement is not our desired outcome, but if it comes to that, it will come to that. I don't know if Dr. McNabb would want to say anything more about that.
No, I think you said it all. I think, my survey today on Main Street, I did see more masks than I had, say, 4 days ago. And there's no harm. And I a couple of times just walk by somebody without a mask and just go like this. And they seem to get it without being an official ambassador or educator. I think we can all do that in a very nice way.
Jason?
Thank you, Libby, for giving that update on kind of what's coming down the road quickly. Just give you a little bit what I've seen the last couple of days and people that I've talked to. I think it's helpful that we're going to help the restaurants. The restaurants don't mind being the enforcers. They already are, in a sense of checking people's IDs, making sure you're not drunk. All those things they already do. It's probably the 7 or 8 people I talked to in the last 24 hours. So it's been very difficult with the bad behavior from locals and visitors, not understanding how to comply, and then these defensive kind of nasty reactions. They're willing to do it, but they need a little bit of help from the town, and I think we're starting to do that with the mask order, with signage, and then the explanation of what will happen if we need to enforce. And so I think that'll help the restaurants, be the enforcers. Just a quick, anecdotal story. I walked into the Handlebar around 10 o'clock, and I had 4 big groups all sitting outside sipping coffee. They all had their masks on. All had their masks with them, but they weren't on. And I felt that little thing that business owners or managers feel, you don't want to offend anybody, but the right thing to do is ask them to put on the mask. So I stood there in a really weird, awkward way and said, "Hi everyone, I'm Jason Bridges. I own this coffee shop. Could everyone please put on their mask?" And then I explained why. We've had some more cases. I know it feels awkward to pull down your mask, take a sip. I don't want to offend you. I want you to come back, but we're trying to be safe here. And I felt that if I had that little bit of extra time to explain it, then it was accepted well. I think sometimes in restaurants and retail, when it's busy, you don't have all that time. So my whole point of this is if the town is helping with the order, with signage, and people understanding the businesses, understanding if people aren't going to comply and kind of get out of hand, right, to make that extra buck, that there is enforcement and they could lose, whether they got to shut down early or we just take away their license. If that is possible, then I think that can help. Sorry, that was very long-winded, but I was going to bring it up later, but Matt, you started it. Thank you.
Melissa?
Thanks so much. I wanted to maybe expand a little bit on the order, some questions that I have received. The clarification of the boundaries of the maps that we have posted. The blue lines are the boundaries of those maps, not specifically the shaded areas for downtown and the village of Census. So if folks are using those, the blue lines are the boundaries. How fines will happen. It was explained at the Board of Health that there will be a warning first, and then and obviously handing out masks. I think the education, as everyone's talked about, and then they're escalated. It doesn't go from warning to $300. I think it was $50 first offense, $100 second offense, third and subsequent $300. But anyone correct me if I got that wrong. Some questions about how this differs from the governor's order, and a reminder that the governor's order requires masks when you're outside and you cannot maintain a 6-foot physical distance with other people. We're asking everyone in crowded downtown and crowded Census Village to wear masks all of the time. So that's a difference. And why not the whole island? I think the rationale was that there's plenty of space, although I think people on bike paths and outside really do need to use common sense. Myself, when I go out for a walk on the different paths I go on, I bring either a gaiter or a mask with me. And when I feel like I can't maintain 6-foot distance between myself and someone else, I put my gaiter up or put my mask on. So I just wanted to address those things that were some public discussion I've had with folks over the past 2 days. Thanks.
Thank you. I think that's probably everything on the emergency orders for right now. Restaurant, change of premise. Oh, Christy?
Sorry, I just have 2 other COVID questions. Just an update on some of the things that we haven't talked about in a while. With Stop and Shop, does anybody know if they're still doing their senior hours? And also if there's any report to Taylor or anybody in the town about kind of the status on the mental health aspect of COVID and food assistance. We just haven't discussed it in a little while.
The senior hours are continuing through the summer at Stop and Shop. And I'm not sure of those status of those other things. We could certainly get Taylor in at the board meeting next week to give a specific update on those things.
Yeah, let's definitely have her on next week if she can. Matt?
Just on the Stop and Shop, we received a text from them today. They are opening a second door and they're going to have a better flow. They're going to have people coming in one door, out the other door, still have everybody counted. So that people will be seeing a change there, and it's a change to make the flow smoother.
Okay, so can we move on to Amy on restaurant?
Yes, thank you, Madam Chair. There are no new restaurants applying for additional space. We were up to date last week as far as that. The past week, we've continued on working through what we've needed to work through on the streets and outdoor dining. We have a couple more things tomorrow with DPW to tighten up as far as some barriers and things like that. Hopefully people have seen what some of these restaurants have been incredibly creative and decorating some of those barriers. So it's starting to look nice, hopefully. Trees, everything, decking, trying to make everything accessible. They've done incredible work. You'll see a lot of these tables they've actually made themselves. So, people have really put in a lot of work to this. So I feel like a couple more things tomorrow to do to tighten this up so that everything's probably good to go for the weekend. And as Artel was saying too, I certainly will assist in kind of monitoring and seeing how things are going. People communicate with me all the time about concerns or things they're seeing. So I'm very much going to be out this weekend just seeing how this flows. So I think that's where we are. There's nothing new to approve. Any questions from anyone on kind of what's going on?
Christy?
I know when this all started, I'd kind of asked restaurants to submit their their best wishes, any biggest ideas. Has there been anything that we've declined or any restaurants that haven't been able to adapt?
Not really. I think we've had to make some compromises, obviously, because a lot of these things affect other businesses. So it's been quite a couple weeks. So we made a lot of compromises. So everything, we might not have closed an entire street or done different parts. So, but there was no really big no's. I didn't get any big idea that we completely said no to, possibly a little decking on Main Street that would have been too dangerous for Lemon Press, but we put some tables out. Backyard barbecue is a very tough spot. We're going to try to see some tables there on the sidewalk, but a couple places like that are in just tough spots. But for the most part, I think we've at least made compromises as much as we could. So that if we couldn't do the big idea, we at least made some adjustments. So, and this weekend is going to be a huge test. I think we'll have as much as we can up and running this weekend. So, yeah.
Hopefully the rain holds off.
Yeah.
We need a nice dry summer this year for these restaurants.
Yes.
Economic Recovery Task Force, Janet?
Thank you, Madam Chair. The Economic Recovery Task Force met on Monday at 10 o'clock, 2.5 hours before the Board of Health met to issue the mask order. We reviewed the progress on the implementation of that task force's recommendations that were delivered to this board on May 20th. 33 recommendations were made, 16 have been implemented, 4 were already in place, another 8 are still being addressed, and 5 could not be implemented because of public safety or regulations. After that review, we met in breakout groups to ask the members to offer additional recommendations and to give feedback on how the town has been communicating in responding to these recommendations. There were 4 breakout groups, and every one of them talked about mask signage, the need for more signage about the mask requirement, and that has certainly been addressed full steam this week. We've got a heavy foot on that gas pedal, and more mask signage at Highline and the ferries are needed, and that's all now being addressed. There was a recommendation about contract tracing. Actually, it's an example of what Nantucket Marine is doing. They have a QR code at their entrance that's linked to a short survey, and people fill that out, and it goes into a database so that they can contact trace anybody who's been in there, and they've shared that with the town for distribution if it seems appropriate. In terms of restaurants, it was commented that restaurants need to be reminded that guests need to be seated before they're allowed to have a drink, and that they need rain plans. Unfortunately, the weather the last 4 or 5 days, at 5 o'clock, the sky's open, and people are then rushing inside the building, and that's not safe. So I think Amy is working with them on that. In terms of steamship and ferries, there was a recommendation proposed to hire a third party to do drive on and drive off if the Steamship Authority Union doesn't allow the staff there to do it. That apparently is holding people up on the Hyannis side and maybe on this side to be able to get their cars on and off because they can't. They're on the wait list, and they're on the wait list overnight. There was also a request to do a public service announcement on ferries about what to expect about the mask requirement and other COVID-19 regulations, and that's underway. NCTV 18 picked that up. They weren't part of this meeting, but they somehow figured out that that needed to be done, and they've been working with Roberto on that. We created a new video that was part of the original recommendation that was finished on Saturday, and then on Sunday we got the news that the mask requirement was changing, so they are revising that video, and we'll be able to send it out. It's being distributed by the chamber to their membership and by the town to various outlets that we have. In terms of summer camps, it was felt, which opened this week, that they also need rain plans because the kids can't go inside and be socially distanced. So I'm not exactly sure where that is, but we'll send that recommendation to, well, Taylor was at the meeting, so she heard it. In terms of communications, the task force felt that the town had done a great job of getting restaurants open, blocking streets and sidewalks. And as I said last week, Amy Backstreet gets all the credit for that heavy lifting. They commented on the creative use of space by places like the Chicken Box, the Muse, the Novadia Fields for the movie theater, and Charlie Noble using that back lot that always looked to me like just a place for dumpsters is now kind of a cool place to hang out. They noted that the website has great information and that it's updated frequently, and they felt that we need more communication about parking options posted where the streets are blocked, because people drive up, they want to go to the restaurant, they don't know where to park. So those are ones that we will talk about in our next back to business work group to figure out how to continue implementing those. I thought it was a very positive meeting. Dr. McNabb was there and sent me some thoughts afterwards, and it's where Jason and Christy. I'll entertain any questions.
Melissa?
Thank you, Madam Chair, and thank you, Janet. It's not so much a question, but a comment that I was reminded today that on the Town of Nantucket's website, on the COVID-19 page, there's help for businesses and nonprofits, and a Back to Business toolkit, which has a great resource of downloadable PDF signs that businesses can use to get printed or print themselves to share information. And I knew I had seen it before, I just couldn't figure out where. So it's a great reminder. And thank you. I guess I do have one question though, Janet. Was there some conversation around how, with all of this help and assistance, how are businesses doing financially? Are they recouping some of the losses, or are they maintaining sort of status quo from previous weeks last year? Or are they still down compared to last year?
Well, as you may not recall because you went on the board at the time, but when the Economic Impact Task Force started in April, we did a survey and had 440 odd responses to do as a baseline, and Remain funded that effort. We've talked about doing that again, but we feel it's too soon. We really need to see the impact to find that out. I don't really have that information. Maybe Christy in her chamber role has heard some of that economic impact, but I don't think we're planning to redo that survey until September or so to find out what the impact was of that overall, and to see if we can relate it directly to decisions that the town had made.
Christy, and then we do have a public question.
Yes, thank you, Madam Chair. Just to follow up on Melissa's question, it's really been varied. Businesses are not at their 2019 level, but they have started to see an uptick in the past couple of weeks. And seeing that retail, especially in restaurants, at least being able to open has definitely had an impact in helping them, but definitely not to the 2019 levels. With lodging, they were starting to see an uptick, and then the surges across the country and the mandatory quarantine in places like New York, where we have connecting flights to Nantucket, have delayed some of those travel plans. And so lodging is starting to see a little bit of a decline again. But hopefully, as we've just lifted a quarantine for local regional states around us, that might see an uptick again.
Thank you. Roddy McKelvey is on with a question. Can you hear me?
Hi, can you hear me?
Yes, go ahead.
Hi. So yes, my name is Roddy McKelvey. I'm sure you all got an email from me. Happy to answer any questions about that. But actually, I, as someone who just got into, someone hit my car. And so with there not being an auto body shop that Progressive uses on the island, I have to take my car off island to the Cape. And I can tell you, it's a headache without them doing drive on, drive off service. I have to, go over, get the car, and do all that. And so I heard mention of a third party service for that potentially, and just would like to vote and support that. I think that would help everyone involved.
I have been speaking to our steamship reps on this for a couple of months. It's a major, major problem.
Yeah, I know the other side is, and Hyannis is a disaster.
And I mean, hopefully they can work it out with the steamship union soon.
Awesome.
With the proper safety measures to have the employees start doing it again. But third party, if that's the alternative, would be great. Maybe.
Awesome.
Keep everyone updated on that.
Great. Thank you.
Thank you.
Might be a job for the valet service.
Right. Could be. Libby, did you already cover most of the PIO stuff, or do you have anything to add?
I think I mostly covered it. With regard to town services, we still do not have a definitive date when town offices are going to open specifically to the public. But as I've been mentioning, we are definitely serving them in other ways. The courts are having a soft opening, they're calling it, on July 13th. As it stands now, but we believe that is not going to mean that the town building is going to be open. The doors will be locked, we believe, and people will be coming in by appointment and be let in by court officers. I was actually kind of mulling over last week, maybe we start thinking about a town office opening mid-July, but with the increase in cases, I rethought that. And with listening to the governor at his press conferences, he's constantly urging people, if you can work remotely, work remotely. If you can keep people away from each other, do that and use alternative measures. So we aren't getting any complaints about it to my knowledge, and it seems to be working out for now. Okay, so I think we're going to continue to reevaluate it as we proceed on here.
And it doesn't mean that people aren't getting services as needed.
Correct. There are many ways for us to serve them.
Matt?
I had one question, and this may be for the chief, but someone is looking to get a license to carry. How do they go about doing that through the police now?
Right now, there's a hold on issuing new licenses to carry. And the problem is the new applications require manual fingerprinting. In other words, somebody has to stand, the officer's doing the fingerprinting, or the clerk, the person's standing right over their shoulder, practically breathing down their neck. And so we're now coming up with a plan and how we can redo that. It's a lot of towns have been able to install barriers and do it through reach through portals and things, but because of the layout of the public safety building down in the permitting area where the fingerprint machine is, that can't be done. So what we're probably going to do, and it'll be done, I hope, by next week, if not then the week after, but hopefully by next week, we're going to set up an appointment system where we can people can make an appointment to come in, and then we'll have a person wearing proper PPE, and that means gloves, gown, face mask, the whole thing, there to do the fingerprinting. That's required for new applications. If you have a existing application or permit that simply needs to be renewed, all you got to do is drop it off to the police station. We've been accepting those, and we have been renewing those.
Thank you.
Amy Eldridge has her hand up. Amy, can you hear me?
Yes, Dawn, can you hear me?
Go ahead.
I just had a quick question about the RMV. I've heard a lot of conversations from people who are having a hard time buying used cars in private sales, unable to register and pay their sales tax for their vehicles. Is there any idea when the RMV here is going to open? Because trying to commute to Plymouth to get an appointment in Yarmouth is crazy.
We do not have any further information about that, and we get calls repeatedly throughout the day, and we are also waiting because it is quite a hardship for people to have to figure out how to get off island, and then there's the boat situation. I know that there has been some contact with our legislators, and I don't think they've been able to break through at this point.
Okay, are there any other COVID-19 related updates, questions, comments? I'd like to thank Dr. McNabb, Jason.
Yeah, just still thinking about the restaurants and for this weekend. I'm very supportive of all the creativity and hard work that all the restaurants have done. I just want to encourage them. I know none of them are listening probably because they're working right now and getting ready. To think of the long term, as in through the whole summer and the fall, and be okay with losing that customer that's not following the guidelines, because people will see that and they'll feel safe, and that will be replaced with someone, the next day. Like, people will know. And I just don't want that urge to cover the loss. Like, everybody's working twice as hard and making half as much, and that urge to make up, April and May and June, to do one more table or allow something to happen. I just want to encourage them to, do the right thing, because if not, we or the Board of Health, the town will be forced to roll back at 10 p.m. closing. Then we'll have to stop indoor dining, and then the next step would be even further. So I want to see everybody really thrive and succeed this weekend and do it right. So that's just some words of encouragement.
Matt?
Just to follow up, what I'm hearing from customers, they've come a little earlier, they're being careful, and a lot are planning to stay a little longer. So, so we may have an opportunity to make some of that up in September and October during weekdays when they usually don't do business, as long as we are careful and don't, slip back too far. So, I've heard people in the yard talking about it. I've heard people say, oh, we came from Texas, two young girls talking, and my parents wanted out. They couldn't wait to get here. We might stay longer. That kind of stuff I hear that once or twice a day now. So I think, if we take care of it, we can get through it.
We have one more public. Rodney McKelvey has another question.
Yeah, I was just curious if there was any data on the economics of how restaurants did during takeout only timing before they could open.
I don't think that there was anything of that compiled yet. Jason?
I think Matt and I heard a lot, like Memorial Day weekend and first couple weeks of June, down 90 to 95% from the previous year, only having takeout, at least for the high-end restaurants. Little shops like mine, down 30, 40%. So I think everybody, it's all over the map.
Yeah, I agree with that. I think they're down. The ones that are doing well now that have opened are down 75%. And they're saying, geez, we're doing great. Of the upscale restaurants, places, sort of our peaks are not as high as our peaks were, for sure. I mean, they weren't here Memorial Day. You don't have that big spike. So it's, but, places that already were takeout, sort of pizza at other places, those are doing a little bit better. The Stop and Shop and the markets are doing a little better. They, not better, and they're doing more. Those are doing more business. Sort of the pizzas and restaurants are holding their own a little better than the other guys. I don't want to give the misconception they're busier.
Okay. Thank you, Dr. McNabb and Artel, for filling in for Roberto today. And thank you, Dr. Pearl, for coming on. It's been a little while, and maybe we can have someone from the hospital every few weeks as things progress.
Yep, happy to come back. Just send us an invite and we'll be back.
Okay.
Thank you.
Thanks so much. Now we're moving on to the public comment portion of our agenda for items that are non-COVID related. If anybody has something they wish to bring to our attention that's not otherwise on our agenda, this would be the time to raise your hand. Sometimes there can be a delay, so if someone does raise their hand, I'll come back to it. I don't believe that there's any new business. We have approval of payroll warrants, treasury warrants, and pending contracts. Are there any questions on the contracts? Is there a motion to approve all three?
Move approval.
Second.
All those in favor by roll call. Jason Bridges. Jason Bridges.
Aye.
I didn't hear you. Matt Fee.
Aye.
Christy Ferrantella.
Aye.
Melissa Murphy.
Aye.
Juan Holgate, aye. That passes unanimously. Consent items. We have a couple of gift acceptances from Human Services, Salt Marsh Senior Center, and Natural Resources Department. Is there a motion to accept those and to send letters of thanks?
So moved.
Second.
All those in favor by roll call. Jason Bridges.
Aye.
Matt Fee.
Aye.
Christy Ferrantella.
Aye.
Melissa Murphy.
Aye.
John Holgate, aye. Passes unanimously. Citizen departmental request for approval and execution of documents with Sachem's Path Homeowners Association. This is a sewer easement. I think that Ken Beaugrand is going to fill us in on this. Oh, Ken, you're muted, or Tucker.
Tucker was going to be
Tucker's
doing
going to
it.
do this.
Tucker, go ahead.
Hi, thank you, Madam Chair and the board. This is a relatively straightforward item. In order to ensure proper operation, maintenance, and coordination with the town sewer system, an agreement has been worked out between the sewer director, the developer, and the HOA at Sachem's Path to have the sewer department assume responsibility for the pump station and the lines connecting that station to the town sewer system. There is a one-time payment of $25,000 coming from the HOA to the Sewer Enterprise Fund for this arrangement. And it's important to note that these funds are not coming from the homeowners themselves, but there was an excess project amount that was originally provided by the CPC. The excess resulted basically from the project being completed a little ahead of plan, and therefore a planned interest expense was less than what was in the pro forma, which is why these excess funds are available. And so $25,000 would come from those excess funds. There were a couple other items that a portion of the remaining excess funds will go to cover, and ultimately $13,000 and some change will come back to the CPC to be used toward a future housing project. The CPC has reviewed all this and approved it. As well, the form of agreements have been prepared and are approved by town council. So we recommend approval.
Are there any questions? Someone just called in as a panelist. Can you identify yourself? It's 280-8465. Tucker?
Yeah, I believe that's David Quinn from Hack on the Cape, which was the developer of the project. So he's just here in case the board had any questions.
Okay, great. Well, I guess
Hi, this is Dave Quinn.
Thank you.
Sorry about that.
Motion to approve, Madam Chair.
Is there a second? Did you say second, Kristen?
Second.
Okay, all those in favor by roll call. Jason Bridges.
Aye.
Matt Fee.
Aye.
Christy Ferrantella.
Aye.
Melissa Murphy.
Aye.
Ron Holgate, aye. Passes unanimously. Thank you.
Thank you.
Now we're moving on to public hearing. So I will open the public hearing to consider modifications to restrictions in the dangerous dog order dated May 20th, 2019, revised June 7th, 2019, regarding 2 dogs owned by Frank Daly, who is on. And Jeremy Cohen, are you going to present the request? And then we have our counsel, Brian Riley.
Sure, thank you. Do you need to take any more attendance before we go?
Well, I know that for this hearing, it's Brian Riley, our town council, you representing Mr. Daly. Mr. Daly was on himself, but now I don't see. Oh, there he is. There you are. And Elizabeth McIsaac. And then there may be some members of the public who wish to comment that will raise their hands. Erica?
I was just going to say, we also have Suzanne Gale coming in. We're just waiting for her to connect.
Okay.
She's the animal control officer for the town.
Susie Gale. Yeah.
Thank you. So do you want to wait for Officer Gale, or am I good to go?
I'm here, but I don't see where my video went. Sorry.
Liz, you're on. We can see you.
Okay.
Well, thank you, everybody, for giving us the opportunity. It's not often a Board of Selectmen will agree to revisit an order that they put in. And the reason that we were asking for the modification is it has been about 13 months now since the last order, and it's no secret that we're appealing it. And the Frank Daly who was at the hearing a year ago as a dog owner, and the Frank Daly who exists now as a dog owner is a completely different person. He certainly would agree that there were several incidents that happened. You know, there were no orders in place, so he wasn't technically violating any orders, but he certainly wasn't considering the community when he was considering how to manage his dogs. I think that after hearing from him a bit, if you choose to hear from him, especially after hearing from Liz McIsaac, who's been working with him for a year, you'll hear that he understands his dogs now, and he understands his role as a dog owner in the community. We're also here not to change the order. You deemed his dogs dangerous. We're not asking for a change in that. We're asking for a modification to one of the remedies, one of the items, which was number 5, which prohibits the dogs from going on public property. Frank has been compliant with that order, even while we're appealing it. And he would just like the opportunity, and we all would, Liz and I, for the dogs to be able to walk them on public land. These Huskies, one of them's older and has arthritis, but they certainly need aerobic exercise. And while Frank did put up a fortress of a fence, that's simply not enough for these dogs. They don't need to go run outside. They just need to go for these long walks, which Frank is used to taking them on. And so he's asking for permission to be able to do that. At the same time, he will, Liz McIsaac will speak about all the new equipment that Frank uses, from a special collar, martingale collar, to a special leash, to a muzzle. Frank absolutely will walk the dogs with a muzzle on. And he will also agree to walk one dog at a time. So what we've learned is it's important to focus on managing one dog in public at any one time. So he won't have to address 2 dogs at the same time. And in many of the instances, both dogs were there, and it's been tough to tell, was it this dog or that dog? And as Liz will say, there's certainly a pack mentality when these dogs are together. So by keeping them separate in the public, you eliminate that energy that the dogs would feed off of each other. I believe that he's complied with everything else, the insurance, the microchip, and the fence. And if you would indulge Liz McIsaac just to sort of explain to you how Frank is a different manager of these dogs in her own assessment of the dogs. It's important to know that she's assessed the dogs. She finds them to be great family pets who need a lot of exercise, who are not human aggressive. And rather than have me explain it, you can hear from Liz, who's been living it with Frank. Liz, can you unmute? Liz, you need to unmute.
Yeah, Liz McIsaac, go ahead.
First, I'd like to thank the Select Board for having me here this evening as a panelist. I would like to, I did submit a bio to Erica rather late this afternoon. I don't know if the board was able to receive that. I know some of you personally, although I don't know if you're aware that I have been training dogs and doing behavior consultation for over 25 years now. My career started out with the MSPCA Angel Medical Center back in 1985. And
Liz, I need to just pause you for a second. Can you make it so we can see your whole head? It's kind of distracting not to be able to
I'm
see.
rather short, so I can attempt to.
Perfect.
Can you see me now?
Yes,
All right.
that's better.
So I was contacted by Frank to do an evaluation of his dogs after several incidents had occurred, and I believe it was after the judgment with the town. And I did. I went out and I actually have a report on here. I don't want to read it verbatim, but I've met with Frank and his wife and one of his daughters on the very first visit, and his two dogs. And the first visit, hold on, I'm sorry, I forgot to turn my phone off. When I first met these dogs, I was very surprised. I've done evaluations on dangerous dogs previously. Just to give you some background, I've owned American Staffordshire Terriers my whole life. The only difference between an American Staffordshire Terrier and a Pit Bull is basically a fancy AKC status. I also have been on the other side, owning over 5 American Staffordshire Terriers. I have been a victim of my own dog being attacked while on leash by dangerous dogs, if you will. And I've also been a victim of my own American Staffordshires being on a leash where a dog has not been on a leash, and my own dog has bitten another dog. And were classified as dangerous dogs in Boston in 1996. And so I've been on both sides of the road with the situation and have some experience with it. When I first met these dogs, I was really surprised that they were very friendly. They had no signs of aggression towards me, and sat down and met with Frank and reviewed some of the documentation he provided me with. And immediately I was surprised by his personality. He was a very nice man. His wife was lovely. His daughter was lovely. The dogs were very friendly. But I can say that we were not on the same page immediately. The first thing that I had asked him was what his goal was if I were to evaluate his dogs, and found that they were not friendly dogs. If they were deemed dangerous dogs, what was it that he wanted me to do? And he said his goal was to have them be able to walk and be a part of his family. He did not want them banished. He did not want them euthanized. He wanted to be able to walk those dogs on town-owned property. He felt it was too restricted to keep them on his property only. What I said to him was, there are dogs that sometimes cannot be rehabilitated. In other words, if it's a genetic issue, behavior modification, yes. Sometimes when I do a consult, it may not be in his best interest. Sometimes the dogs can exhibit behavior that cannot be changed. It may be an inherited behavior other than a learned behavior. And he seemed to be okay with that. However, I've got the impression that he didn't feel that it was his dog's fault, that maybe sometimes these things happen and it wasn't necessarily his fault either. One of the biggest problems I had was that his dogs were not always on a leash when these incidents occurred. When I heard that, I was really upset. I live in this community and I feel that there's a leash law in Massachusetts, and regardless of the dog's behavior, he is responsible for that behavior, period. So I left him with some information and I told him I would actually come back the following day to do a physical evaluation on his dog and talk with him further about his dog's behavior, which I did. And I realized that he really was committed to his dogs. And I needed to not only work with the dogs, but I needed to work with Frank and potentially changing his understanding about his dog's behavior. Upon taking the history, I realized that these dogs grew up in a family. There's a cat living in this home. There are multiple children in his home. His partner, which is now his wife, his dogs go to work with him on a daily basis. They knew their basic obedience command. And in this yard that abuts the farm, they have an opportunity to have people coming and going. There's multiple activity in his home, never showing any signs of aggression whatsoever. Upon my evaluation of these dogs, a complete stranger, I did do a physical evaluation to elicit pain. No reaction whatsoever, which was unusual because the male dog, Soldier, is arthritic, and doing the type of evaluation, palpating his spine and his legs should elicit some type of aggression. Did not have that. Over a year, I participated in 22 visits with these dogs and with Frank. The Frank that you see now is not the Frank that I met 22 visits ago. It was amazing working with him and some behavior modification training with him and his dogs. The change. It did no longer go, well, you know, hey, my dog was off the leash and got in a fight and they seem to be the victor. Now, impressively, is, wow, I didn't realize how my dogs off leash were so dangerous. I didn't understand that they could be this way when they're together off a leash. After that first incident, I needed to be more responsible. I can't believe this has occurred, and it wasn't necessarily their fault, it was my fault. They had a tendency to be this way. And what I found with these dogs is, because of their breeds, they're husky crosses. There's two different types of huskies. There's Siberian huskies, and we have also Alaskan huskies. We don't know truly what they are because he adopted them from shelters as adults. The difference between the huskies, one is an AKC registered husky, which has basically been bred out of their type of behavior. Fancier dogs, if you will.
Liz, I'm going to pause you there for a second. Okay, so we understand. I don't think the board necessarily needs all the information you have about.
I know it's really kind of a lot of information.
What I'm going to do is just ask you some targeted questions. So
okay, that would be easier because it's really a lot of information.
I'll get you there. Okay.
Thank you.
So I mean, it was very clear to me when you first.
Oh, you got the report. Oh, okay, wonderful.
The report, not one from today, but
no, there is no report for today, but a while ago.
We've seen your full report.
Okay, that's perfect. That makes it so much easier for me. Okay.
That's not a current report, but it was a report, I think, as of maybe 6 weeks ago or 2 months ago.
Right. Okay.
Clearly, yeah, I was part of these calls. It was not working with you and Frank the first few days, and but you stuck with it. So can you tell us what equipment did the dogs and Frank? What equipment does he use now with these two dogs that he wasn't using before?
That makes it very easy for me because it's been a year I've been working with them and there's so much involved. Initially, when I evaluated the dog, I did not like the collars he was utilizing. The leashes that he had were inappropriate. And the first thing that I did was I purchased 4-foot leather leads muzzles, and I also purchased professional martingale collars. These are through Ray Allen, which is a professional wholesale company that sells products to police companies and tactical units within the government. I have a wholesale account with them. I needed to have products that will not come apart in the event of an emergency. In fact, they sell a lot of Schutzen products, which is German. Schutzen is a German.
Okay, I'm going to pause you again.
Training.
I'm going to pause you again. I just want to help everybody get through it with.
All right, no problem. So, in other words, no fail equipment. So if the dogs were out, the leashes are not going to break, the collars will not break, and they can't slip through the collar.
Okay, so you're saying if the dogs were to back up, they can't back up out of the collar?
That is correct.
Okay.
They're made of nylon and chain.
So these muzzles, how do we know the muzzles don't come off? What is different about these muzzles?
They have a strap that goes over the head and connects in the back, as opposed to a regular Velcro nylon slip-on muzzle. And they're fitted to the pet's circumference of their nose and the broad part of their head. You have to measure professionally to make sure that they fit accordingly to the dog.
Okay. So the community here would say, hey, everything's gone great for 13 months. So why should we disrupt it? We have the peace we were looking for, PEACE that we were looking for. But as a community member, I mean, this is you. You're out there with the same people, with your dogs. As a community member, clearly you wouldn't want Frank and the dogs out there a year ago or prior. But what is your personal opinion right now about what I spoke about, Frank walking one dog at a time with all the restraints on?
Well, what I would want, first of all, is the community to understand that there are several types of aggression. These dogs do not have aggression. They have predatory drive, which is an instinctive, innate behavior. Aggression, a lot of people misconstrue predatory as an aggressive behavior. It is not. It's an innate, instinctive behavior. So what this means is they reach a certain level of arousal and they continue on with that arousal to aggressively, if you will, use that word, which we don't like to kind of stalk, pace, and then chase.
Okay, I'm going to pause you there for a second again.
Yes.
Okay.
Yep.
You're talking about this. Are you talking about towards people or towards animals?
Absolutely not. It's towards animals.
Okay. Great. Next question is.
Yes.
The next question is, you as a person in the community, not as a trainer, as a person in the community, you, just about these dogs and Frank, one at a time, one dog with the restraints, walking with Frank in public. Just tell us your opinion about that.
I believe that Frank has done a 360 and he's done a very hard job with working with me and these dogs, is capable of doing this. We've worked with my own dog, with my husband, with him holding both dogs. And I think that anybody with their own dog should not be walking two dogs that have that level of arousal. If you work one dog with a muzzle, utilizing counter conditioning techniques, you will be successful. I just want the community to understand that you cannot control your environment. You will undoubtedly have a chance at a cat or a dog you may encounter. But what we have worked with one dog at a time, he is certainly capable of controlling that dog with a muzzle, with a proper collar, with a proper leash.
Okay, so now the question becomes, if I'm a neighbor or in the community and I attended the meeting last year, well, why did it take this to happen? So the question here is, and I can explain some of it, and it's that there was never a formal hearing before, but now there is. But these things you're talking about, these behavioral traits, these restraints that you get wholesale, and that you need to walk one dog at a time. These are things that pet owners probably aren't, you don't get a pamphlet on this. So
No.
do you think Frank's learning about this stuff for the first time from you as to how to be a better manager?
Absolutely. I don't think he understood his dog's behavior. Most people don't. I can tell you right now, there are many people on this island that have dogs that do have behavior issues and aggression issues. And that's because we love dogs and we adopt our dogs from various shelters from across the country. I've trained many dogs with aggression issues on this
island. Let me pause you there, because it's a beautiful night, I think, down there. It isn't up here, but I think I see the sun there. So the dogs themselves, I alluded to it earlier, but I'm not a dog expert. Why is it important for the dogs, if we're going to think about the dogs here, not that they're certainly secondary here. Why is it important that they get out of this yard for a walk or something?
Well, first of all, ethics. It's humane. These dogs have lived a life where they would run 3 to 4 miles a day before sunrise with Frank. And he would do leisurely walks on public property, however, against my and his better judgment. Walking them in open space off lead as pack with predatory drive is inappropriate. Now that he has been educated, Soldier, please forgive me, is getting older and has arthritis. So we have a dog that should have mobility with his joints. They need to be enriched, mentally enriched. If you have a dog that's used to doing so much and then confine them to a small area, he has followed he has been compliant with the fence. I've worked the dogs in their yard and just in their property. You're reducing that mental enrichment. And my fear, and we've seen a little bit of it thus far, can create other behavior issues where the dogs start to develop chewing problems, howling, barking, by not allowing them to participate in regular dog. Just think of your own dogs. When you have your dogs and you don't have time to walk them, what happens? Other things occur, and it just builds up and builds up.
All right. So it's this mental enrichment, which is and physical enrichment, because there's OCD things that develop, and
absolutely.
Now, so let's just address the what ifs, because there's always a what if crowd. What if the goats, or what if it was a child? My understanding here is that there's 2 tracks. There's either this aggression, this drive right towards animals or people, but it doesn't cross. Here, someone might say, well, from a distance, how is that dog supposed to know the difference between a small child and a small animal? First of all, Frank will be right there with the dog within a few feet. But now we use our ears and our eyes, but the difference here is these dogs have scent, an unbelievable scent ability. So is that how they differentiate?
Yes, and I just want for you to understand is that this is why it's not called aggression. It's a behavior. It's an innate behavior where, just to give you an example, cattle dogs are, they're herding dogs, have the exact same behavior as a predatory-like behavior. However, it has been bred out of the dog for centuries. So the dogs, they have that aggressive type behavior. They're very highly aroused. They are excellent at what they do. Border Collies, Aussies, these dogs are phenomenal, but they have OCD-like behavior. So these dogs do exactly the same thing, just to put it into perspective for you. They're not running around veering off that red zone and attacking children, nor will his dogs. His dogs have never shown one iota of aggression towards a person. You're right. They, with predatory drive or drift, if you will, utilize their senses. The only time you ever have to worry about aggression under those circumstances is when you're dealing with other type of aggressions. There's a ton of different aggressions, but we're talking about redirect aggression. And the reason why I'm saying this now, There was only one case of that, and that is when his wife was walking their baby with a carriage, and the gentleman tried to break up a fight and put his hand in, and he got bit. That was the only time. Those dogs will never mistake a goose, a deer, a goat, a cow for a child, ever.
And if they were to see a goose, a goat, a deer, the difference now is they've got
muzzled and on a short lead with one dog.
Okay, and with a new Frank. So
that's correct.
All right. The last piece here that I just want to address is now that there's an order in place, that the town has this order. Because I watched the video and I know some people concerned, well, what does the order really do? The order would still be in place, right? We're asking that you scratch out number 5. Still though, if Frank violates, any pet owner violates the order, there's 3 things that the board has available to it, and Officer Gale and Pittman have available under the very law we're operating under. One is the dog can be immediately seized.
Yes.
There's, and I'm just sort of sharing this with everybody too, but there's fines and there's jail time. If this dog, either dog, were to attack, especially down here, livestock or fowl again, under the same statute, 140, section 159, that person would be entitled to triple damages. And also the town would have the right to restrain the dogs. So it's not a matter of, oh, if somebody sees Frank without the muzzle, now we got to go through this whole hearing thing again, and then he's going to hire a lawyer and it's going to take a year. It's a lot different. There's still, I mean, there has to be a valid taking and credible evidence that he's violated the order, but you don't just violate it a little bit. You either violate it or you don't. So if we were to make a modification, there's still significant strength in enforcing this order.
May I inject something also? My training, as far as I'm concerned, is not completed with him either. And I would also, this was one of my biggest issues, is not being able to work the dog in the field, if you would, although I did include my puppy for a couple training sessions with them. I would love to have the opportunity to have a session or two with the animal control officer just on the bike path abutting his home, so that she can be privy to the equipment that I'm utilizing and the work that he has been utilizing with me, so that she can professionally see what we're doing and see the response between myself and Frank. It doesn't just end here, but they have learned to do this on their property, but it's kind of canned. You know what I'm saying?
Frank,
I care about my community, and I care about the dogs in this community, and Frank does too.
Frank, if you want to unmute for a minute, you heard everything we had to say. If there's anything you care to share, now would be the time.
I think, first of all, thank you for even hearing us out a second time. I think to make it kind of short is that, prior to our hearing last year, I was far too cavalier in my thinking. I had a tough time rectifying how my dogs that are, integral part of our family have been around, multiple newborns, and they take food out of their mouths and poke them in the eyes. How could I take that on one hand, on the other, see these incidents that happened? And unfortunately, I was making excuses to myself and to the community, saying, well, there must have been something else happening. They were just the dogs that were getting into a skirmish. They didn't start it, but they finished it. And that was a very pig-headed, foolish notion for me to ever think. It's not something I would tolerate from my children. I would never allow them to have that excuse if they ever got into a confrontation with another kid at school. So for me to, do that for my dogs and myself was wildly foolish and something that I had to come to terms with and change. Through this past year of working with Elizabeth and just obviously the whole new reality of the way my dogs and my family operate, I could see all the mistakes that I have made and the things that I needed to do to protect the community and give them the lives that they deserve. That I am the one that screwed up. I allow the dogs to be that obviously affected the community, affected other dog owners, and then affected the dogs that I say I care about so much. And I had blinders to that. So, we spent a lot of time on my property working with them and changing their behaviors, but more importantly, changing mine and finding my own flaws in what I was doing and being able to see that, yes, they can be good family dogs, but they could also be a problem too, which was the thing that I needed to allow to come together so I could, handle them appropriately.
Great. Thank you for the time. Madam Chair, if you want
to. Thank you. Brian, should I open it up to public input, or does the board have any questions?
You can certainly do that if you like. I have a few things that I want to add for the record, but you can see what other comments or questions you have first.
Does the board want to hear from Brian first? Okay, Brian, why don't you add your input, please?
Okay, thank you. And good to see everyone. As you know, Mr. Daly did reach out to me and ask to address the board again, and so that's what brings us here tonight. Just for the record, as you know, you issued this order a little over a year ago. It was appealed. We did have a hearing in front of the clerk magistrate last July, which is a relatively informal proceeding, and the clerk magistrate affirmed the order. But the statute does provide for a second appeal, which results in a bench trial in front of a judge in the district court. So that has been put off a couple of times. At the moment, it's scheduled for August 4th. That is it's called a de novo hearing, means you have to have live testimony, exhibits, all that sort of thing. Again, asking, Mr. Daly will be asking the court to, change the order or get rid of the order, and, the board would want to see it affirmed. However, as you've heard, Mr. Daly really only has an issue with condition 5, prohibiting the dog from going on any town public property. And so, I thought it made sense to put this before the board, let you hear from him. It has been a year. And decide if you want to agree to, tweak that condition 5. I'm pleased to hear that, they are offering to, only walk one dog at a time, have a muzzle on it. I think Officer Gale would like to share her thoughts on the muzzle as well. And so I think that if the board does want to agree with that, and it's something that Mr. Daly thinks he can live with too, what I would see happening is that we would basically settle the litigation that way. We could file an agreement for judgment, setting forth all the terms that both sides agree to. The written order would be revised as well. And I agree with what Attorney Cohen said. You wouldn't start all over again, particularly if we've got this entered as a judgment with the court, basically. If there was an incident with violations, we could ask the court to assess fines. You can, seize the dog immediately. So, hopefully it would never come to that. But the board would have, significant, enforcement authority, and you could go back to the court and ask the judge to, enter those sorts of orders.
Thank you. Should we hear from Officer Gale?
Sure.
You're muted.
Can you hear me now?
Yes.
Okay. So I have to agree with Liz. I'm glad he's working with Liz. I know Liz very well. She's very good with her dogs. Anytime these dogs are never harmful to people. I never had that issue with them, so everyone just knows that. Like, hands-on with these dogs. I was able to pick them up, put them in my truck, drive them where they need to go. I've seen them with the family. They're great family dogs. They do have high aggression, and I'm glad that Liz is working with him. And I'm just concerned, like, he is now going to walk one at a time. That's great. That's what I want. That he keeps it on a short leash, not that running leash, a 4 to 6 leash, and a muzzle, preferably a basket muzzle. I'm not sure which muzzle Liz was just something that he doesn't slip off. That's all I was worried about. I don't see any issues with them going out in the public if he does those things. And hearing him saying the things that he's learned, and you guys are still working on it, and he keeps working on it, then I don't think the public's going to have an issue.
May I say something, Madam Magistrate?
Liz, yes, very briefly, if you don't mind.
Yes, no, and that was my reasoning for asking for Susie to be a part of one of my sessions, so that she can become familiar with the equipment that I'm utilizing and the technique, which is positive reinforcement, no shock collars, none of that, just good quality equipment in control management. Because I think when you're dealing with a innate behavior, genetic behavior, doing complete modification is very difficult to compete with that. So just learning how to control under various circumstances. And I think we can do that very well with just try to work with Susie's schedule.
Thank you. Thank you for offering that. Frank?
Sorry, if I may, just to give everybody a visual representation, these are the muzzles that are custom made to their heads, and they're strapped around the back. There's no slippage. That is their leash. This is the tactical leash that has been discussed, and that is their collar, the Nightingale.
Thank you. Matt, you had your hand up. If we go to board questions.
Yeah, I had just a couple thoughts and a question. First first thought was something that Attorney Cohen said, no formal hearing before. What happened was not our fault. It was not the public's fault. Frank took responsibility for it. I want to be sure, I want that on the record. It wasn't because we didn't have a hearing that this happened. Frank has admitted why this happened. So I think that's really important. I heard that, and I assume that was a misspeak, number one. Number two, Liz, are you certified as a behavioralist, veterinarian?
I am not. I'm actually studying now with, I don't know if you got my bio, but I have been doing courses now. First, I need to get certified as a certified pet dog trainer. And I was scheduled for testing, but it was canceled in September due to COVID. So once I get certified, I did the very first instructor dog training course by those people actually created the certification course. So I'm like almost grandfathered for that one, but it's a technicality that I have to do. And then I will take the test to become a certified dog behavior counselor. One of my mentors, Dr. Amy Martyr, she's a veterinarian, and she's an applied animal behaviorist. And she said that she would back me as an expert witness for this specific case. I've been studying for over 25 years. And I have a lot of experience in aggression and fear-based behaviors.
Would you say that would we be better to have, would it be, do you feel confident enough that you know enough about it, or should we have a second?
I do feel confident, but I'm more than happy to refer you to Dr. Martyr if you feel that you would like to have these dogs evaluated. She works out of Lexington, Mass, and I had even consulted with her about this case. She provided me with some of the information that's in my report. If you see in some of the literature. She's actually, in the end of it, she's in that documentation. You can contact her certainly about my experience, and also see if she'd be willing to do an evaluation of these dogs. But I feel confident speaking about these dogs. It is my name at the end of the day. If these dogs were to harm a person or another dog, that I know the liability. And I also just want to share with you that I am insured through the Dog Trainers Association that I belong to. I have insurance that holds me liable and protects me. And I trained for the town of Nantucket and always held my insurance with them as well. I can provide you with a copy of that.
Matt?
Yeah, I just, I'll be honest, I came on not wanting to change my mind at all, with a second opinion, with it only being Frank, possibly with certain hours, et cetera, I might be convinced. I could be convinced. I think it was pretty heartfelt what Frank said, and I hope. So anyway, so my take on it is if we had a second opinion and if we had some tight restrictions, so that we knew, I might be fine with it.
And I also would welcome any of the board to participate or observe, audit a training session. I think that is extremely important. I have to be honest, when I first met, I didn't know Frank at all. I had never met his dogs. And the picture that was painted was not a very pretty one. I went in there, I've evaluated some very aggressive dogs. I've been bitten many times. And it was really odd to just flip a latch on a fence and go in there in a submissive body stance and have these dogs licking me up and down, having no issues, and then going in to evaluate, not even looking at these dogs to take notes. And they were like licking my toes. I had flip-flops on and bringing their toys to me. And it was just a very odd situation to see dogs with a predatory drive that they have, then playing with their cat, and then seeing a baby like playing jump rope with its tail. It was a very unusual situation. I have signed this death certificate of many dogs on this island, just so you know. I've evaluated many dogs and recommended their euthanasia.
If I can interrupt, I'm just going to pause you there, Liz, because we kind of got our.
I know.
I know you're answering a question, but we got our opportunity.
Thank you. I do need to turn to any public comments. I do have one hand raised. Meg Galugi.
Hi there.
Hi.
Hi. I'm unfortunately, I came in a little late, but I'm getting the gist of it. I'm involved with NISHA, and I'm a professional dog trainer as well. And my question is, again, I'm sorry, I missed the beginning, but have these dogs ever been evaluated by an actual behaviorist? And I mean a PhD. Like, have they been taken off island with Frank and had an actual behaviorist write up a full report? I'm just, as a dog trainer who also handles lots of aggression and fear-based issues, that would be really important just to me. Also, speaking of that, also having had, as recent as the other day, I actually ended up having to post on the year-round community page, two dogs attack my leashed dogs on Joy Street the other day. So
that was horrible.
We still have lots of issues with off-leash dogs, and I just would want to know that they've been evaluated by a professional.
I'll take it, Liz. I'll answer that, Liz. They haven't. Dr. Martyr, certainly, there's maybe, as you know, Meg, 4 to 6 people who can do it in Massachusetts. Dr. Martyr, Dr. Dodman, so Dr. Bornswil, It's just because they're off island, it's difficult.
But I did consult with Dr. Martyr regarding this case, Jeremy.
I know you did.
Okay.
Can I just continue? Can I continue to take the public comments and get all of that input? And then if you want to do a final response at the end.
Oh, don't answer the questions. Okay.
Yeah, can we, because I just don't know how long, because maybe you can consolidate the answers all into one, all at once. James Bryard.
Hi, can you hear me?
Yes.
Perfect. Yeah, so my name is James Bryard. I owned one of the dogs that was attacked by Frank, and, it's been over a year, and after hearing everything that the trainer and Frank have said, it seems like he's really put in the work to try and, address the issue of having a predatory dog and needing to have control over that. And, I'm trying to come to this more from not from a place of like fear or anger from what happened. And I think especially being his neighbor, as I live right down the street from him, I think I would be okay with him being allowed to walk them on public property as long as they had that muzzle that he showed and the leashes that he had. And I think he is strong enough to control one of the dog at a time. And, obviously I will probably end up running into him at some point. So I'll have to, and he's been open to working with me on like, if we see each other, go different directions or avoid each other. So, it seems like he's trying his best to address the issues that were there. And, I would vote for feeling comfortable for allowing the dogs to be walked again, just for the dog's sake.
Thank you, James. Is there anyone else who'd like to raise their hand? Now would be the time. Attorney Cohen, did you have any follow-up? Or I think you pretty much answered.
Yeah, thank you for coming back to me, but I'm satisfied. Thank you.
Okay. Melissa.
Thank you so much. Through you, Madam Chair, I'm a little confused on exactly, and maybe this is for after we close the public hearing, but I'm a little confused on what conditions are being asked of us tonight. Are we to come up with those conditions at the close of the public hearing? Or what specifically are we asking to be changed and what conditions to be set? Are they based on Elizabeth's recommendations? Can we come up with our own? I'm a little confused.
I believe, if I may, that he's asking for the waiver of the one condition of the original decision. I think that it is up to us what conditions we put on that. I think initially they were hoping that a muzzle wouldn't be required, but it sounds like now they are offering that would be definitively required. And if there's maybe anything else that the board would wish to see. Brian Riley, is that the gist of it?
Yeah, I'd say so. It's really that condition 5 that, that they would like to see changed. And so, and to me, I think you could, if you wanted to, if the board wanted to, you could basically strike condition 5 and maybe add in that in its place that, only one dog will be walked by an adult at a time. It'll have this particular muzzle and short leash in place, and handle it that way.
Melissa?
Thank you. So, and then I think this is a question, and it could be through Attorney Cohen to Liz. In her report, she writes it's right before the recommendation, the concern of the dogs that, and I think this is to highlight that, but I just want to be clear that off leash through behavior modification, they cannot be controlled when that predatory drive kicks in. And I think it says, I'm concerned that because of the level of predation and the ages of the dogs, we would fail. I'm just asking for some clarification on that statement, if that means on leash or off leash training.
And I'll touch upon it for a second, and then Liz can. I know she's worked with Frank to sort of distraction technique. If how to get the dog out of that zone as soon as he can recognize that the dog is suddenly going into that zone. But since they're Liz's words, Liz can speak to that after she unmutes.
Liz, you're muted.
Sorry. Yes, usually when you're dealing with a dog of that age that has a instinctive predatory drive, no, it's usually what you do to counter condition that behavior is utilize something that is appeasing to the dog to distract it or motivate it away from that arousal or trigger. To do that, you would either utilize food or toys, something that the dog is very motivated by. And it's to do that prior to the heart rate raising or the respiratory system increasing. Unfortunately, because this is a husky breed, the predation level is high. And I think with a dog like this or dogs like this, utilizing a piece of chicken or liverwurst or trying to use a tuggy toy would be ineffective if the dog were off leash completely because you're not in control. However, if the dog is on leash, I witnessed using hot dogs were effective. So I say in defense of myself in prior cases, in most cases off leash, you're going to fail completely because you don't have control of the dog. To limit its vision, you usually would put yourself as a block so the dog doesn't see what the trigger is. But if you can't do that, if the dog's not off leash, it's gone. It's gonna just increase.
Melissa?
Thank you. And this may have been made clear in the report, but I'm a little foggy on it. Is Frank the only adult in the household who's received the training on how to control the dog on leash?
Yes, and part of our discussion has been the two adults would be trained to do the same exact techniques depending on where we're going from here. During the initial training, his wife was not actively involved because we were just working in technically a backyard. So it didn't seem at that time it was appropriate for both of them to be actively involved, but pending this meeting, that would all have to change.
So is the proposal that Frank alone would walk the dogs independently, or is the proposal that any adult within the household who's been trained,
Jeremy,
would walk the dogs? And other piece of that question is, could they walk the dogs together? Because that brings back in the whole pack potential.
And Liz and I spoke about this, and as you heard her say, right now, I don't think that if the other adult is Frank's wife, I don't think that she's there yet to be able to do that. And the situation would be, we don't want both dogs out there together. So one dog, one person. Frank can do his walk and come back and get the other dog. I think there has to be sort of, maybe if it's somebody at Liz's level or Officer Gale where they understand dogs, but I think any adult would sort of need to be authorized besides Frank, because he's the one who's put the work in.
Or someone like Meg or there are other trainers on the island that are certainly qualified to assist in walking and working with Frank if they were so interested.
Okay. Is everyone comfortable if I close the public hearing at this point? No one else has raised their hand. So I'm going to close the public hearing. Oh, Christy, are you saying no, or you just want to talk?
All right, I just had one more question on it can be a public hearing or board questions, but I did just see another hand go up.
Oh, let me, we'll go ahead and ask your question and then I'll go to Andrea before I close the public hearing.
This might be a question for the lawyers, but is the town liable in any case if there was another attack on an animal or a dog or person?
Brian Riley.
Yes, thank you. That is a good question, obviously. And not to delve too much into legalese, but, if, let's say the dog got off and injured somebody and someone wanted to make a claim against the town saying, well, you could have prevented this if you left the order in place. In general, or I'd say, until many years ago, basically governments, whether it was the state or municipal, were immune from getting sued for things like that. Then Chapter 258 of the General Laws was adopted, which has certain, monetary caps and things, but does make the government able to, be found liable on a claim. But there are certain exemptions under that. And the one that's relevant here is called the discretionary function exception. And what a court would do if faced with a claim like that is look at, what's the degree of discretion that the board or this town officer had in making this decision? Were they making sort of a policy decision, and they had a lot of discretion on how to formulate that? In my opinion, this is very clearly, and the statute is designed to give the board lots of discretion deciding which one, which condition, which order is going to work in a given case. So I guess to sum that up, could somebody make a claim against, the board or the town based on some kind of incident like that? Well, they could certainly try, but I think the likelihood of town liability is extremely low.
Thank you. Can I take the public comment and then come back to you, Matt? Andrea Morris. Andrea, can you hear me?
Yes. You can hear me?
Yes, go ahead.
Okay, so I just wanted to know what would happen if there isn't an incident with the dogs, but if Frank isn't in compliance. So if he's walking them and they don't have a muzzle on or something like that.
Attorney Cohen.
So as Andrea, we talked about a little bit earlier, but glossed over it maybe. It's all about compliance, and there's not being a little bit compliant. He either follows these all or he doesn't. There doesn't need to be an incident. We don't want to get it to that level. So if he violates, if he doesn't have the muzzle or the leash or the collar or the other things that have been ordered, that's a violation of an order. And as Attorney Riley said, it would actually be a violation of a court order, because we would enter this as a judgment in court. And the stakes are pretty high for that. I know that Frank understands that, and I think he understands the stakes. Frank, if you wanted to just say do you understand what the stakes are for just not doing anything?
Frank.
For not doing something?
Frank.
Yeah, sorry. Matt brought this up earlier, and I wanted to respond to it. The what ifs. I have obviously a tremendous vested interest in not having any violations. I understand the severity of this. I understand if there's even a simplest infraction of the leash not being on, or the muzzle being loose, or something, that I am putting myself, my dogs in jeopardy of them being euthanized, which is obviously what I don't want. So nobody will take this more seriously than me. And I understand that I'm on very, very thin ice with this town and this community. And I am aiming for, every time I bring my dogs for a walk, to prove that I'm doing everything the right way.
Thank you. Are there any further public comments? Matt, did you have a question?
Well, I guess the question is to Frank, through you, or to the attorney, would you be willing to go for a second opinion off island to be able to have this happen?
Frank, if I can jump in first, I'm certain if it came down to it, there'd be a willingness. But I also think that because these dogs, I think that Liz captured it based on huskies in general, and these huskies in particular. They instinctually, they have this prey drive to go after animals. And we're certainly going to find out where the dog has no history of an experience with biting somebody unless it's involved in trying to break up a fight, I don't think that a behaviorist is going to teach us more. I don't think we're going to learn more about it. I think it's, but if there's certain cases where behaviors should be required to say, is the public at risk? But I think one thing that could happen because of Dr. Martyr's understanding of this case is perhaps she could do like a Zoom eval. Dr. Martyr has MS, so it's hard for her to get out, but she's been doing this forever and she knows her stuff. I'm just thinking about convenience. Perhaps she could surely do it. If we give her all the history, like Liz had all the history of these dogs, and maybe she could do it by Zoom if possible.
Liz. Liz, you're muted.
There you go. Matt, I'm more than happy to provide you with a plethora of information that I have collected also from, I belong to a lot of memberships, and I've reached out to many people throughout this year. And I've been exposed and worked at the MSPCA in Boston 14 years, and personally have handled many dogs like this. I can give you some of the information, you can review it, and then like Jeremy said, potentially we could reach out to Dr. Martyr. Go ahead.
No, my point, Liz, I trust, I trust you. I know how much you care. And my question really is, do we have, we also have a duty to the community.
Absolutely.
And the community felt very, very strongly. And I think as a board, we have to do everything we can to make sure that we are protecting the community. And if we're willing to have Frank and his dog evaluated together with somebody who really knows their stuff, I'm all in, and I'll vote for this tonight, predicated on that. That's what I'm suggesting.
I'll take two follow-ups from the public. Andrea Morris had her hand up again, and then Meg Galugi. And then I'm going to close the public hearing.
So the other thing that I wanted to mention was Liz had said that the dogs did really well in the yard with hut dogs, but their level of arousal is going to be much higher out of the yard, and out in public there are much more distractions. So that doesn't mean a hut dog is going to work on the bike path.
I never implied that.
Let's just try and keep it through me. Comments. Meg Galugi.
The only thing I did want to just point out is there are plenty of behaviorists. There aren't only 4 in the state of Massachusetts. And I know for a fact, a lot of them are doing Zoom consults right now. The only difficulty or problem is many of them have a backlog. So, at Angel, I know there's a 3-month backlog. I have a connection with a gal in Southern New Hampshire. She's not booking till October. So those are the issues that would arise with trying to get a second opinion with another behaviorist.
Liz, quick follow-up on that. Do you think that you could get with the doctor that's already working?
That was at the very beginning, that was my issue because of COVID. The majority of behaviorists that I know, and I'm not talking about behavior consultants, veterinarians that are board certified in applied animal behaviorism, there is a backlog. There is at least 2 to 6 months before you can be seen. And there are some that are doing Zoom evaluations. That's the biggest issue. And I consulted many in the tri-state area. I've worked with several, and I usually don't reach out to people that I don't personally know or have a specialty in predatory aggression or, drift.
Thank you, Liz.
Sure.
Matt, follow up?
Yeah, a couple things. First, the hot dog thing, I can't help it, but that works for me. If you throw me a hot dog, I'm on it.
But that's what I meant by the can't. I'm sorry.
I know, and I'll behave myself inside and outside of the yard. I'll be fine. But just kidding. But how effective is the Zoom? Is a Zoom evaluation? Wouldn't the evaluator want to have Frank and the dog and have them there and walk them through sort of a crowded area and make sure, do the things that we haven't done yet? Wouldn't that be more effective?
Correct me if I'm wrong, but are we hearing that that's really not an option during COVID, or that they're not seeing people that way? Because I agree. I mean, I don't think it's going to be that worthwhile. I think that the time that Liz has spent in her experience is much more valuable than someone doing a Zoom call. It's like my friend who's a therapist who said marriage counseling over Zoom is not at all effective. Liz?
Hold on. The only thing that I can share with you is the hot dog comment, although it's funny, is this. From the very beginning, I have expressed that the only opportunity I have had with these dogs is in a canned environment, if you will. I cannot go any further with these dogs in training because I'm restricted. So what I'm saying is the very small amount of activity that these dogs have been exposed to are canned activities staged with my own dog. That's it. So I want to make that very clear. These dogs can only be aroused so much in a canned environment. And number two, as far as doing a Zoom consult, you can do that. Most applied animal behaviorists are relying on statistical analysis. They're relying on psychology and animal biology from training. They don't necessarily have to specifically see your animal unless it has a seizure-like behavior that's occurring at that time. My own dogs that were deemed dangerous because they were on leash, but they happened to be victims because they were pit bulls. When I went to see Nicholas Dodman, he didn't even have to see my dog. He took her histories. He saw her medical behavior issues. He saw her blood work, and he just said to me that gray matter, they don't have a whole lot. They have a tendency to be OCD. He went down a great list of issues with the breed. He had exceptional experience with the breed, and that was it. But the problem is, even doing a Zoom evaluation, you're in wait. Terry Bright in Boston is phenomenal. I've known her for quite some time. Dr. Marta is the same thing. I mean, Nicholas Dodman is now doing a whole new thing, Center for Behaviorism. He's doing statistics now. So it's a matter of who you're talking to. They're really backlogged because of COVID.
Melissa?
I have to say I'm not terribly concerned about a sense of backlog. I think to Matt's point that there's a great deal of community concern if this board feels like getting a second opinion and that happens through Zoom, then it happens when it can happen. And
Sure.
I'm not in any particular rush to change this condition if we don't feel comfortable that, or if we would feel more comfortable, or the community would feel more comfortable with a second opinion. So I just want to put that out there. But I feel like we've heard everything we need to hear from the public, and I feel ready to move on to board discussion.
Yes, I agree. Those last remaining comments, I said I would close the public hearing. I have a few thoughts, if that's okay. I think that a lot of work's been done here. I think that this particular, if this stuff had been done before the first hearing, I think we would have probably allowed this type of a situation as long as the muzzle was on and the short leash and the one handler. I would be comfortable with allowing Liz McIsaac to be an additional handler for these dogs so that she could continue to train with them. I'd like to see if we're going to allow this, her continued training and, you know, the potential that maybe she continues training them while you wait for an appointment for an evaluation with a true behaviorist. I feel like dogs' lives are a little bit short, and I don't want to necessarily push this out 6 months. I also know that we have a court date in August, so this was kind of a request for a settlement prior to that, which has not been lost on me. The biggest, one of the biggest concerns I have is that I don't ever want to be in the position where I have to put a death sentence on these dogs. And if this were to be violated, that feels like it's probably the choice that would be put before us. And that would be absolutely horrifying for me. But I'm feeling pretty confident after the testimony today that this is being taken very, very seriously. I'd love to hear from other board members. Christy?
Thank you, Madam Chair. It's a couple of things that I jotted down. I agreed with Matt when I first kind of saw this on the agenda. I had no motivation to change anything. It was very clear with the hearing last year and the community comments that we received, you know, how much the community felt they were in danger because of these dogs. And so that I think that is something that we could work on. I do feel comfortable with the provision put forth that they're always on a muzzle and that it's just one person. I would feel a little bit more comfortable if we could get that second opinion. In the meantime, I would be comfortable with changing that last restriction, number 5, to maybe allow for training on public roads or streets. So if Liz needed to work with the dogs in that environment outside of their yard, that would at least give her time to train them. And then maybe we could revisit this once that second opinion is ready and we've had that additional training. Another thing was hearing Officer Gale here saying how comfortable she was, I think is another pro, and also hearing from Jamie Bryard, who last year was very concerned and having been in that confrontation with the dogs and now feeling comfortable. All those things have kind of shifted my mindset that we can work together to find some kind of common ground and way to move forward. And in the future, I would like to see both Frank and his wife be trained so that you have just more options. Thank you.
Thank you, Christy. Jason?
Thank you, Madam Chair. A question for our counsel, Brian Riley. So if something is violated, let's say we were to go forward and say condition 5 is changed. You can walk on public with one person muzzle. Something's violated. Officer Gale can make a report and prove it, and it's legit. Our options are cease, fines, jail time, cease or restrain. What does that mean? The town owns the dogs, and then we have to go. Is our only option what Don was referring to? I just want to be really clear on all of that.
Yeah, it's through you, Madam Chair. I mean, there is some flexibility in there, but let's say the dogs were found running loose, somewhere, because the order says what it says about being on a leash at all times. The dogs could be seized. Before the board wanted to, I'd say, make a new order, I think you'd have to hold a new hearing. But the statute does talk about criminal penalties, and that's what the fine is too. So you could go to district court and get a hearing as quickly as they'll give you one, and ask that a fine of $500 be assessed against the owner. It does refer to jail time. I can't imagine judges are too keen on putting people in jail for this sort of thing. But it's, that shows that it's a significant statute and significant enforcement. And again, if it came to it, if it happened a couple of times, even the board has the authority to, have a new hearing and order euthanasia. Obviously, as Don said, that's a last resort. But that's there as well.
Okay. Madam Chair, may I ask? So if the town seizes the dogs, then we have to have another public hearing to figure out what to do with them?
Well, I don't know. Jeremy, do you want to add anything to that?
If I can just jump in for a second. Under 140-158, a police officer, constable, or animal control officer may capture, detain, or in the case of a threat to public safety, euthanize a dog in a humane manner if found to be in violation of an order of a hearing authority or district court. So that's pretty, I haven't seen it done, but that's pretty strict in terms of, that's pretty specific what the authorities in Nantucket could do.
Okay.
Melissa, then Matt.
Actually, go ahead, Matt.
No, mine is just if it's as long as it's clear in the order and we're and not back arguing about it later. I mean, the goal is Frank's going to do what he said he's going to do, and we believe him. But we don't want to drag. In my opinion, I don't want to drag this out and be nitpicking about it. Both sides. I mean, I think so. Anyway, is there a way to write it up so that we agree what happens? So it's just clear to the public, clear to all of us, and not, well, maybe you can do this and maybe you can do that. And now we have to have another hearing. Part of the goal would be to clear this up, in my mind.
Well, I think there could be different things, like a muzzle breaking and nothing happening would be different than a full-on dog attack or slaughtering of livestock, in terms of what the penalty might be. I don't know if we can fully contemplate every single scenario in terms of what a violation. Brian?
Yeah, if I may, I would agree with that. I mean, you want the order, and when it's reduced to a court judgment, you want it to be, pretty clear what the owner is required to do. And as I say, there are different consequences. The board could, hold another hearing and order the dogs be disposed of, or you could go to court and ask for a criminal finding and a criminal fine to be imposed. I don't know that I kind of hate to see it become this, 3-page schedule of what's going to happen if this happens. I don't think that's necessarily the way to go. And there is, there's some, as I say, there's some pretty strong options the town would have to enforce a violation.
Yeah, and don't forget, there's also 2 dogs involved. There could be a violation with one dog and not the other. Melissa?
I just want to make sure that I'm clear. The recommendation for the reconsideration of condition number 5, which does not currently allow dogs on public property, the recommendations would be 1 dog at a time. So never an instance, even if there are 2 adults who become allowed to walk the dogs, they cannot be walked concurrently. That Frank would be currently the only member of his household who would be able to walk a dog. Liz, we would allow for purposes of training. We would encourage the Daly family to have Frank's wife trained to walk a dog. The equipment that was recommended, the muzzles, the leather leads, the martingale collars. And, for me, in terms of the continued training, is there some kind of report this board would like to see in 6 months or a year? I mean, are we going to revisit the condition again if Frank's wife is trained to walk the dog? That's curious to me how that would work. But in general, if those are the compass heading of the conditions we're talking about, I feel comfortable with those.
That's what I was thinking, and I do think we would need to revisit it to, if you will, add anyone to the list of allowed handlers. Does that make sense?
Yeah, if I may, I think that would be pretty easy to do. You know, if part of the order now is that it's only Frank or a trainer who's working with him. You know, if after some training they come back and say, well, now, you know, now his wife is fully trained and is able to walk one dog at a time. I mean, in a sense, you'd have to do this again if you want to change the order, but I think it could be a very, you know, much quicker process.
Matt?
Yeah, and I would be fine. I'd be fine with that if we were revisiting it, and you know, and maybe at that point we could have a behaviorist if it's necessary. You know, I'd be fine that way. I think for the public, I think we have to be clear. We're talking, you know, are we talking land bank land? Are we talking conservation property? That's really not our purview. So, you know, we have to make sure that that is understood.
What would be defined as public property? I mean, obviously it would be sidewalks and bike path, town-owned land specifically, but I would think that the land bank land would be also considered town-owned land, since they're a quasi-town organization, but Conservation Foundation is not town-owned.
Correct. If I may, if I'm remembering the documents, yeah, I wasn't there at the hearing last year, is that someone from the land bank, the land bank took the initiative to ban these two dogs from land bank property. So one, I don't think the board necessarily has the authority or would even want to reverse that, you know, on behalf of the town. But I think, you know, I think if Frank wanted to have access to the land bank property, I think they'd have to, you know, deal with those folks.
They would have to authorize it, but us alleviating this would allow him to make that request if he wanted to.
Right, correct.
Is that clear, Matt?
Yeah, and exactly, and I think that's fine. And I would want to make sure it's understood that it's only going into crowded areas, only going into places with, you know, with Liz with him right now for training purposes. You know, sort of do it early in the morning and do the things that you want to do in those times until we're 100% sure.
Jason?
Seemed like Melissa, you had it all kind of like written down in front of you. I agree with everything you said. So if you were to make that motion here at some point, I would support that.
Thank you. But I'm hearing from Matt that maybe in addition to that motion would be that walks that Frank takes with the dogs. I'm not sure, Matt, if this is what you're proposing, is that another condition is that the walks happening without a trainer are happening early in the morning or late in the evening. Okay.
How would we define that? And in the off season, when there's not people around, I don't know. I think most people walk their dogs in the morning and in the evening as well. So I'm just wondering what the exact proposal is on that.
Could it be more advisory in nature and less specific? And I guess this is a question for Brian, that the board suggests or advises that the walks take place at points during the day when these public spaces are less crowded. And I don't feel like we have to make this so specific that there's not discretion, but good judgment and guidance. And I think we're giving Frank permission to have some good discretion within certain bounds. I'm not sure the time of day needs to be that specific, but
yeah, that's honestly, that strikes me as another kind of condition that is almost asking for an argument. You know what I mean?
Okay.
But Frank and Attorney Cohen are listening to all this. I'm sure he's taking it to heart.
So in that case, then the motion would be without those restrictions of time in place, because those may not be enforceable. So the motion would be one dog, to change the condition of number 5 to one dog at a time, Frank only, unless, and for purposes of training, having a trainer with one dog, but never the 2 dogs walking concurrently. They must have appropriate gear, which I know is not a technical phrase, muzzles, the recommended muzzles, leads, collars, and continued training with an update to this board, I would say within 6 months, on the continued outdoor training of the animals and training of another adult in the household.
Second for discussion.
Is there any further discussion? I didn't know if we wanted to add that Officer Gale have an initial check-in with Liz McIsaac, like she had offered, to make sure that all of the equipment's the right thing and she feels comfortable. Susie,
I would feel comfortable adding that.
Okay. Is everyone ready to vote by roll call? Matt Fee?
Aye.
Jason Bridges?
Aye.
Christy Parentella?
Aye.
Melissa Murphy?
Aye.
John Holgate, aye. That's unanimous. I really hope that this goes very, very well.
If I may, Madam Chair, so, my suggestion now with this is I will work with Attorney Cohen to reduce this to writing. We can give it to the board so you can, approve it as a formal amendment to the order. We can get it filed with the court and get away from that August 4th date. And, that'll put that whole looming deadline, behind us and take it from there.
Do we need to vote on it at a subsequent meeting, or can we just sign it if it's
I think,
if it's
I can go back and forth with Libby,
okay.
and we'll try to capture everything that you just voted on, and then you could simply endorse it.
Perfect. Thank you.
Okay.
Okay.
Sorry, Don. Susie had her hand raised. I don't know if.
Oh, Susie, I can see your hand. You're muted. Still muted. Oh, there you go.
Can you hear me now?
Yes.
Okay. I have no problem working with Liz and checking on the dogs to make sure everything's in good order.
Thank you very much. Appreciate it. Okay, thanks everyone. I think that concludes that. Anyone who is here for that hearing can drop off, and we'll see you soon.
Thank you for your extension.
Installed the next day for design and no interest for 1 year.
Next up, we have a town manager's report. We were going to do the 4th of July public safety plan.
Thank you. I'm going to turn this to the chief.
Chief Pittman?
Yep, I'm here. We are going to this weekend. Let me bring up my map. We're going to run an operation this weekend very similar to prior years. It's going to have a few less checkpoints than we've had, but basically the traffic controls that we'll have in place will be restricted parking at some of the busier beach areas, including out on Dionis, Eel Point, Nobadeer, Ladies Beach, and Nantucket. In particular, out in Smiths Point area, we're going to have Mass Ave blocked off from parking from New Jersey Street on out. We're going to have at Nobadeer, we're going to have Nobadeer Avenue blocked from Boulevard to Novadear Beach, there'll be restricted parking. At Dionis, it'll be Eel Point Road from where it turns from the paved road to the dirt road on out, be restricted. At Cisco, the access to Cisco Beach, that'll be restricted parking along there. The only parking out there will be actually in the parking lot. And on in Nantucket, Nantucket Avenue from basically Baltimore Street to the end of Nantucket Road will be restricted in parking, or from parking there. And then at Matacasham, there will be an access to the park. There's a parking lot out there at Matacasham. From Matacasham Road into the parking lot, it'll be restricted from parking because we have a tendency for people to block the road out there. They can't get in or out. And then I mentioned Ladies Beach, there'll be around Ladies Beach and Cisco Estates and that area, there'll be officers that'll be monitoring the parking and the traffic going in and out of there. We'll have ATV patrols on the beaches. We'll have check officers doing both roaming and fixed point patrols to assist anybody that is trying to find a place to park or information on what beaches they can go to. We'll be handing out, we'll be getting, advising people of the COVID beach regulations. As far as the spacing, we'll be limiting the number of cars that actually go onto the beach. We'll have staff that will be counting cars and trying to stay within the limits that have been established for each beach. Right now, the weather's looking fairly good for Saturday with a slight chance of rain. So we anticipate there'll be a lot of people. So we would encourage people to, seek out the areas that are least populated so that they can spread out more. The DPW and the various town departments have been installing extra trash receptacles, dumpsters, porta potties, and things at the beaches in areas where we typically experience heavier usage for that stuff. There are no downtown activities or fireworks, so we don't anticipate any extra efforts for the evening hours other than normal staffing. Any questions?
Any questions? No, Melissa?
Thank you so much, Chief. Just to be a little pest about it, will the officers on patrol have extra masks to hand out to people who are not able to physically distance?
We have a few extra masks. We have been carrying some for a while now that we hand out to people, but typically it's when we come in contact with them on calls for service or other means is when we do that. They're not going to be driving around looking for people to hand them out to because quite honestly, most of the people will be on the beach and the officers will be on the roads.
Understood. Thank you.
Christy, and then we have a public question.
I know you just went over in detail all the different restrictions and parking. And is there a map anywhere or something that we could put out before Saturday?
We'll have it on our put out on social media and on the webpage. We just got it finalized today, so we've been kind of busy over here trying to catch up with everything. But we just got it finalized today, and so I can get it out tomorrow.
Thank you.
It pretty much is the same areas as prior years, so nothing's really changed except for out in the Ladies Beach area.
Thank you. Roddy McKelvey.
Boy, kudos to you guys for how much time you guys put in on a weekly basis. Chief, so what time do we need to get to the beach to get a car on the beach?
Probably about 6 a.m. I think you'll need to get there pretty early if you're going to get on the beach. And the other thing, what we experienced in prior years is sometimes the crowd, once the crowd establishes and it cuts off car traffic, even if there's even if we haven't reached the capacity of cars, we shut it off to cars if it's going to endanger the crowd that shows up. So earlier the better.
Thanks.
Mm-hmm.
Thank you. Okay, I think that's it. Hopefully it's a good, quiet, mellow, socially distanced 4th.
Fingers crossed.
We put off the discussion on the town election and town meeting follow-up till next week. So for select board's reports and comments, we have a continued discussion update as to the Racial Equity Race Relations Task Force Community Forum. Rachel's going to take us through.
Sorry. I just have a couple minor updates to provide you with. We had a meeting with the Nantucket Employee Empowerment Team today, where we sort of discussed what we would like their role to be in this process, as well as the discussion about the request for proposals, or the RFP, that will help us develop a strategic plan. I think it was a very productive discussion. There was a good group of people on there, diverse group. And some of the discussion also involved around how we can get more. So maybe even reach out to other members that are on the team that weren't able to attend, or other town employees that might be interested in participating in this particular topic. They will meet again next Wednesday, July 8th. We didn't really pick apart or discuss the specific elements of the RFP yet. They have it and they're going to review it. And that's why we're going to meet next week to get their individual thoughts. A lot of the discussion surrounded, what do we really want to get out of this, not only for individuals, but also for our town employees and for our community, and what their role is, as well as the different boards that also exist. And then we sort of had a little bit of discussion surrounding the job description and the development about the diversity office. And that really was a well-rounded discussion. And I think everybody recognizes that this is a complex issue and we don't want to rush. We want to make sure that the tools that we're putting in place and the path that we're taking is done correctly and well enough so that we have a good toolbox to start moving forward. We don't want to just start making steps and doing it quickly and posting the job and putting somebody in there and then sort of having to backtrack and say, okay, well, maybe we should have done this a little bit different or a little bit better. So I think the way we're sort of looking at this now, and based on other feedback, not just from this group, but from a few others, is that maybe the job description, the position might be tied into what we did get developed out of the results from the RFP. The other sort of discussion that's happened is the Council for Human Services. I know Taylor Hiltz, as the Human Service Director, is that staff liaison for that group. It is now a full 7-member board, which is great. But again, it's summer, things are reopening, people are busy, and trying to schedule 7 people at a time that works for all of them. And because many are new to a town board, and getting all of that groundwork in place has been a little challenging, but she's working on that. And we do hope to have some meetings scheduled coming up so that they can begin this exact same discussion that myself and Amanda Perry, the Human Resource Director, had with the Employee Empowerment Team. And then we can also broaden the discussion with different groups. One thing that I do want to say is I think a lot of what we're talking about doing with this RFP related to the position is they are sort of kind of combining themselves. I think originally we had, let's do this and have them work parallel. And now we're sort of realizing that they really are very interwoven. And a lot of that has to do with, we want this person to be successful, or persons, and we don't want them to start on a path where they don't have a clear, transparent plan or expectation of what we want from them. But not only that, we also want to have a good consensus from the different groups and individuals, as well as from our community, about what they expect. And I think some of the discussions I'm hearing and having is people's interpretation of even words and the definitions and what they mean to them are very different. So we want to make sure that we have that consensus while we're developing the plan going forward, so that we have a lot more accountability for the position, for individuals, and for our community. And we really want to look at the word accountability is also synonymous with commitment. So that's sort of my update. I wouldn't say we're moving slowly. I would say we are moving in a very positive direction, and we are taking our time to make sure we do it right. So I don't want people to think that, this is, it's dragging on or anything like that. We certainly are trying to make the appropriate steps and take in all the information that we're hearing from people. So I do think hopefully within the next month or two, we'll have a little bit more feedback from the NEAT group as they meet next week, and maybe we'll need more meetings depending on how the conversation goes, and also with the Council for Human Services. I will be working with Taylor shortly to sort of kind of outline what the expectations this board sort of set for that group in developing the mission and specific tasks, and what that the new advisory board that we would like the Council for Human Service to help us develop. So I can circulate that to you as well. Hopefully next week we'll have something so you can make sure that we are also on the right track of, and I'm understanding what you are asking us to do through the Council for Human Services. And I know that we need to circulate the job description to you as well, just to get your feedback. And I think that's about it for my update for now.
Thank you very much. It's been very thorough. Are there board questions? Jason?
Thank you, Rachel, for the work you're doing there. And I agree that you and we are moving very carefully and in a positive direction. And to some, it might not seem fast enough. To others, it can seem too fast. But if we keep talking about it every week, I think people will understand that we're not letting it go. It's not just checking out the boxes. We're really going to put time into this for the long term. We're going to do it right. One question I have is, I understand RFP for a strategic plan. That strategic plan will map it out for us. What is a time frame on that? Is that done in a year or 18 months, or is that more maybe done in a 3 to 6 months? I know we can't put a date on it, but just in general, is it closer to 3 months or 12?
Yeah, sorry.
No, it's it.
I think some of the discussion we also had today, which really helped me hear from other people as well as what their expectation of getting out of this. There's definitely things that we think will happen. The RFP will not just be a strategic plan, which obviously is a long-term. It will also identify short-term things. It's also going to do a lot of data analysis. That was something that obviously came up. Like, we really need to understand what our community makeup is, and then where that needs to be addressed going forward. So there needs to be some tying in of that information, which will take a while to gather. And some of it also was, well, maybe the census might pull some of that out for us. Of course, if the census isn't fully complete and, people aren't filling that out. So, those items sort of always overlap a little bit. But I think what we're seeing is there are definitely some things that would be like a 3-month goal, 6-month goal, and then more long-term. And it obviously will evolve as we evolve, as our community evolves, as issue evolves. So we don't want to be tied to one thing that, a year from now, it made sense today, but maybe it doesn't make sense for a year from now. So that's also where this position and this department will come into play, because that evaluation will be ongoing. Obviously, nobody thought we would be here on July 1st where we are right now, and COVID impacts and everything else that's going on. So we're all very aware that things can very much change where you expect them to be. And I think we're looking at that in this RFP through that lens. Once it is developed and we are able to advertise it, it will probably take about a month through the advertising and getting the response back. And then one thing that we haven't really fully vetted yet that we need to have the discussion is who will be on that team to evaluate the proposals. It's usually internal towns, the departments, our procurement officer, finance director, things like that. And is that the same approach that we're taking to this or not? So that's one question that sort of came up, like, well, that's great that you do the RFP, but who's going to evaluate the responses? So that's another, there's just some details that we need to start working out. And the way I read it and the way I see it is that we will have, the smaller steps, the 1 month, 3 month steps, but we'll also have things that will extend 18 months, 2 years beyond.
Christy?
Thank you. And thank you, Rachel, for doing all this work. I think it's a really smart decision to kind of not slow down, but to pull back and really evaluate how we're going to move forward. I know a big discussion that we've had in the last couple of weeks, has been about a community forum. And I was just wondering if there was any update to the thoughts on this.
Not from our end at this point. I think we were sort of using that as a collaboration with you. I think that was something that this board has brought up potentially having and doing. If that is something that you guys really want us to engage in and start the process of figuring that out, and then who could facilitate that and what the goals or the discussion will be that surrounds that community forum, we can certainly start working on that. I don't know if we maybe stopped doing a little bit of that simply because part of the RFP, once they were involved, was to do individual focus groups in the community. But I think my understanding of what you wanted to do with the community forum was a little bit separate than what those focus groups would establish. So I don't know if there's anything specific on that, if there's a little bit more discussion or some directive that we could get from you guys to understand what you want us to really do to set up. And then I would be happy to help work with the rest of the town admin team to get that going.
Any thoughts on that? I mean, if we're going to do a forum now, we'd have to do it in this format, right? Melissa?
Thank you, Dawn, and thank you, Rachel. I'll just echo everyone's thanks for this. I think I understand the scope. I feel like it bears worth saying that let's not let the seeking perfection be the enemy of progress. And so I don't want to, while I want to be thoughtful, I don't want to also not take steps forward. So a couple of things have come to my mind. One is a question right now today, if anybody in our community or staff member has a concern around racial equity, either in treatment or an issue around race, what is the appropriate venue for them to bring that to our attention, and to whom do they go to? And then my second thought is that putting together an RFP for a strategic plan really is going to be reliant on information that we do receive from the community. So I might like to see first us hire a facilitator who could help us with a community forum, essentially initial steps of what I would consider anyone in planning to really do, which would be to host a community forum and really let us get a broader vision of what issues it is we're trying to address. And that will help us, I think, inform all these other decisions we need to make. And so if that means that we need to put an RFP out to hire a facilitator to conduct that forum and perhaps any breakout sessions that would then lead and inform a strategic plan, I'd like to see us move forward on that as quickly as possible. So I guess I want to know, one, how the board feels about that, and two, what is the process for community members to address their concerns today?
Rachel, did you want to answer the current concerns? And then I was just wondering, I don't think we need an RFP necessarily for a facilitator. We hired a facilitator for the board's strategic plan. And I'm not sure about the process. I don't think we issued an RFP.
The facilitator for the strategic plan helped develop the strategic plan, and we did do an RFP for that.
We did, okay.
But it depends on the cost. If it's not totally too much, then we don't necessarily need to do an RFP just for a facilitator. But this community forum idea surfaced quite a while ago, and I know Brooke is an attendee. I don't know if she wants to speak on this, but she has had some ideas about getting the Council for Human Services involved and perhaps other community groups to jointly figure out a way to hold a community forum. Certainly there could be a facilitator that perhaps is jointly, engaged by this group. So it's not just the town doing it, because I know that was a concern too. So just a thought.
Brooke Moore. Brooke?
Yes, I had to wait for the request to unmute. Hi, thank you, Madam Chair. Thank you, Libby. I just wanted to say that I'm part of an organization that is in the process of forming itself and formalizing itself, and it is our hope work in the community in terms of a racial climate assessment through forums, focus groups, and interviews. And that has all been accelerated and shifted a little bit because of the commitment that the select board and town administration have had in this area of racial equity. And so it is my preference, actually, that there be an initial forums, focus groups, I'm not sure how it would be structured, that come from sort of more on a grassroots basis from the community rather than from the town government, and that maybe Rachel, the Council for Human Services, can learn from those some of the concerns of the community. We're in the process of meeting with a firm and talking about the potential of making that happen. So there are grassroots things happening in the community that just haven't come out in the public eye, but I thought maybe now was the time to mention that. So.
Thank you, Brooke. Matt?
Yeah, I think that to me sounds very hopeful, because I think that would help inform, if it's the government sort of saying it, but people think the government is the problem or part of the problem, then I think it coming from the community makes more sense. I think what Melissa was saying about having forums and doing that are great. I think if we get to an RFP level, we have to identify, some individuals, sort of that have, sort of either expertise or experiences that maybe don't exist on the, on the committee that would be picking it. We have the same issue with coastal resiliency, where the group itself would like to have a couple of the scientists involved in the RFP, and it's legal, but it's kind of not how we do things. The same thing here. We might not want just staff to the RFP. We want other people alongside, I think. That will bring more buy-in. That'll bring more cohesiveness to the process.
I'm not sure if Melissa's first question had gotten answered on kind of what's the venue now.
Right. So I think, and anybody can jump in that could correct me if I'm wrong. I would say that if there is an employee-related internal, obviously they go through the channels of human resources. They could always contact me as well. But if it is community or interaction with the department, maybe the Council for Human Services might become a good venue, or the development of the Diversity Advisory Board. But since that's not officially developed yet, I think that's where we would probably have them just filter through me. But I think what we wanted to do is utilize the Council for Human Services in this type of way, where they could kind of vet this and guide us and help us. But I do agree that the community forum developed through the community that has that, it's not town organized, that might provide a lot of guidance for us too. But again, I do understand that sometimes we've had issues where, and it's not just surrounding this topic, where there might be a community that struggles with a certain department. Often they come through the town admin office, and that's how we deal with it. But if people are not comfortable doing that, maybe this is how we could utilize the Council for Human Services Board. So that's something that we can certainly explore beyond just the internal employee interaction, which we always filter through human resources. And again, people are more than welcome to contact them as well if they have a certain interaction or concern that happens with their public interaction with a group or a board as well. So I think there are a few people that have done that in the past where they are challenged and they will contact our human resource department, and then they can kind of explore, what's going on, what happened here, and work it through those type of channels. I don't know if that fully answers your question, Melissa. I think
it does. Thank you, Rachel. It's a great start, but I just want to make sure that we are not in a situation where people don't feel like they can have an avenue to be heard. And I think we've done a great job of, explaining the role of public comment and, how these meetings address sort of the business management of the town. So for me, and I love the idea of what Brooke has alluded to in terms of the grassroots community effort of, truly adding a larger lens on the issue rather than a narrow focus of what town government can maybe focus on. But we are responsible for our own house. And so while I think that that's a really great tack, I also think that we should consider having some kind of facilitated discussion around how people perceive government limiting their participation on Nantucket, how they're perhaps served or not served by us, so that we can take those steps. Some of them will not require a strategic plan to alter. And again, just, not letting perfection be the enemy of progress. We think we know what we need to address, but we don't know 100%. What we do know, we can start to address. And I think we're doing that. What we don't know, we need to provide a venue for our community to speak with us and hear from them. So then we can decide clearly what issues require deeper focus, deeper training, how to evaluate policy changes, for example, through a racial equity lens. That's something I think we could all really use some training on. And yet there may be some other things that we can do quickly. So I don't want to ramble on, but my suggestion is that if there's an opportunity for us to hire somebody to facilitate a community conversation that is either in concert with what other outside groups are doing or separate from, it's all really good information that's going to lead to progress.
Are there any other board comments tonight? We'll be getting the job description to evaluate for next week. Do you think, Rachel?
I can probably circulate it first thing tomorrow to you.
Okay, great. Okay. Next on the agenda, we have committee reports. Does anybody have any new committee reports? Christy?
I serve on the NCTV 18 board as part of the select board. And we just had a meeting last week just about how NCTV 18 has adapted during COVID. And I also just wanted to have a special shout out to their team for how much they've worked with the town on getting information out to the community and, all the information that they've held for different programmings, surrounded about mental health and economic health. They really covered everything. And just obviously all the work that they do with getting us on Zoom and up and going. Last week, I also attended a MMA event. They had a webinar kind of talking about reopening across Massachusetts. And Secretary Mike Keneally talked a lot about the challenges that different towns were facing. And it was just really interesting to hear how many towns were kind of unable to move forward with closing down streets or putting together plans. This event was last Thursday, the webinar, and towns still didn't have things together. And so I just really wanted to say kudos to Amy and the whole Back to Business, Janet, the whole Back to Business work group that really worked to get everything opened for our businesses. And lastly, they talked a lot about federal programming. So I have a recording of the webinar that I can forward along, but there was a lot of opportunities for towns to invest in their downtown businesses and think about a long-term economic recovery and kind of what this recession is going to do to a lot of the mom and pop shops, which of course is all of Nantucket. So that was just a couple of the updates I wanted to pass along.
Thank you, Christy. Anybody else? Is there a motion to adjourn?
So moved.
Second.
All those in favor by roll call: Matt Fay,
Aye.
Jason Bridges,
Aye.
Christy Ferrantella,
Aye.
Melissa Murphy,
Aye.
Glenn Holgate, aye. Thank you, everyone. See you soon.